Adrian N. Breitfelder, City Clerk, you are hereby directed to call a special session of the City Council to be held on Tuesday, March 22nd, 2022 at 6:30 p.m. in the Historic Federal Building for the purpose of conducting public hearings on certain fiscal year 2023 department budgets.
Thank you. Good evening, and welcome to a special session of the Dubuque City Council for March 22nd, 2022. As a reminder to our participants, you can provide in-person input or virtual audio and written input during tonight's public hearings. Input options during the live meeting include: in-person attendees may approach the podium when the mayor asks if there is any public input for the public hearing they would like to speak to. Remote attendees can log into GoToMeeting using the login links, phone numbers, and access code that appear on the broadcast and live stream and posted on the front page of the meeting agenda. This option includes audio input and written chat input. If you are participating via computer, indicate which public hearing you would like to speak to in the chat function. If you are participating via phone, indicate that you would like to speak when phone lines are unmuted. All phone lines will be unmuted during each public hearing, and city staff will determine the speaking order of the participants. All comments, whether in person or virtual, must be accompanied by a name and address. Additionally, written public input is accepted by contacting the City Council directly from the city's webpage at www.cityofdubuque.org/councilcontacts and through the City Clerk's office email at ctyclerk@cityofdubuque.org. This information will be reiterated during the meeting. Attendance for the session is as follows: Mayor Kavanaugh,
Here.
Council members Farber,
Here.
Jones,
Here.
Resnick,
Here.
Roussel,
Here.
Sprank,
Here.
City Manager Van Milligan.
Here.
Thank you. So our public hearings for tonight are for fiscal year 2023 department budgets, and Mayor Kavanaugh, I will turn it over to you.
All right, thank you, Adrian. Looks like our first presentation tonight is from the Emergency Management Department. We have no improvement packages requested at this time, so Tom, I'll turn it over to you.
Okay. Thank you, Mayor and City Council. I appreciate the opportunity to be here again to present the FY23 budget for emergency management for the commission. As you can see, our mission statement hasn't changed, and it's still very valid to this day. We can go on to our Emergency Management Commission is set up in the State of Iowa Code, Chapter 29C, and it states that the commission is made up of the mayor of each city or their designee, and the designee for the City of Dubuque is Fire Chief Rick Steinis. Also, the member of the Board of Supervisors, which is currently the chairperson, Harley Pothoff, and the Dubuque County Sheriff was Joe Kennedy, who makes up the commission, along with the mayors of the 21 cities that are in Dubuque County. The creating an equitable community of choice, there's a few things we're working on there. We did learn during COVID in some of the vaccination clinics and such that to reach out to people in congregate shelters, we've been working with to come up with more community shelters, working with churches and smaller groups, which would make some of the vulnerable populations more comfortable in their own setting. And with that, the state of Iowa Homeland Security just kicked off an initiative where they're going to be looking at the FEMA programs that are offered to people within the state. And I have signed up to be part of that on a steering committee if I'm chosen to do that. But they want to make sure that all the FEMA programs are reaching the people that they need to. So that's kind of an exciting thing that they kicked off right around the first of the year. So it's just kind of in the survey, but that'll be probably a multi-year thing that will come out to make sure that we're reaching the right people after a disaster. So kind of excited about being part of that. The fiscal year 22 highlights, obviously the COVID-19 response. I have a picture there. It's not real well, but the showing our vaccination clinic that we set up last November out at the Fire Training Center. EOC coordination and activation, and the main emergency support functions that we worked out of were emergency management and resource management. We were able to get PPE in from the state of Iowa and get it out to the medical community. With that, last November, or last fall, we were able to supplement our local response with, we now have a 30-day supply that was provided to us by the state of Iowa. So we have that now in the event of another spike that we are going to need to provide PPE, gloves and gowns and the whole, all the PPE needed for treating whether it's COVID or the next pandemic. So also, I continue to be a member and a support person to the incident management team, along with their public health and hospitals. It was a little bit of a busy year last year as far as storms go. We didn't have any real big rainstorms and flooding, but we were able to recertify the city and the county for the Storm Ready program. So we're up for 3 years again on that. We did have 6 severe thunderstorm warnings last year, and we did have 2 tornadoes that did touch down in the county in the rural area. Fortunately, they were mostly through the farmlands, but there was some houses that were destroyed down by Bernard, and that is the actual picture there of the Bernard tornado as it started over the Jackson County line and came into Dubuque County. Also worked close with the planning with the Field of Dreams game and helped with the local response to that as well. Future initiatives, again, continue to assist with the coordination of our local response to the COVID-19 pandemic, work to coordinate responses to severe weather events and our flooding events, work with our spotter system, our emergency, our weather spotters and our network that we have through the law enforcement, fire departments that are out spotting. We act as the eyes and the ears for the National Weather Service, and we relay that information back to them. We complete an update of our comprehensive emergency management plan, multi-hazard plan, and also the city severe weather plan. And we're also working, coming up with lessons learned and gaining information from the derecho that went through the state a couple years ago. And we want to take that information, work through our emergency support functions with the various people that would be involved, and then come back and have an exercise, a full city disaster exercise with that. And also on the horizon, our Dubuque County multi-jurisdictional hazard mitigation plan will expire in February of 2024. So we're going to apply for a planning grant, and that brings together all the communities, the county, emergency response folks, and we'll start that process this fall, and it has to be, it'll be sent to the state and then on to FEMA Region 7 and actually approved by FEMA headquarters in Washington, D.C. So, and the reason that is important, any kind of hazard mitigation project that we do in the county, we have to have a valid and approved, FEMA-approved plan for that. So that's an important process that we'll be starting. Probably take, the 9 to 12 months of planning and get it in, and then hopefully approved well before our February 2024 deadline. Also working with the radio replacement plan for the 911 board, including our law enforcement, fire, and emergency medical services. So we were fortunate yesterday to get approved for some of the county ARPA funds that'll replace some of the radios for us that are already past their life expectancy and are no longer supported by the vendor. So that was huge for the 911 board to be able to work with the supervisors and provide them for their emergency responders. Some of the exercises that were really kind of put on hold because of COVID and not being able to get together. So we do have our triennial full-scale exercise at the airport this April. So we'll be working with the hospitals, all the staff at the airport and local responders to, as well as the University of Dubuque airport. They're the students that are involved at the airport to, they provide our mass casualty victims, so we'll be working on that. We're also going to conduct a long-term care facility and public health exercise for, as far as CMS requirements for some of the facilities, they need to have community-wide exercise, so we'll have that in May. And then also there's other exercises working with some of the colleges to conduct a safety exercise. We continue to work to transition from our Code Red system to our Alert Iowa system. Working with Communications Manager Murphy and Randy Gale has been a big help with that. We're going to continue to do trainings this year. We are under contract with Code Red through the end of this year, and then we'll, at the end of the calendar year, we'll just transition all over to the Alert Iowa. So, and also it's been a while since we've done the incident command classes, which is the in-person ones, the 300 and 400 level classes, which is for the mainly command staff with Sheriff's Office, police, fire, emergency management, public health, who would be in charge of an event. So they are 2 to 3 day classes that are in person that we'll hopefully host right here at the Fire Training Center. Our requested property tax support is there with the operating property tax. Our revenues are remaining the same from the city and the county. Right now, our federal emergency management performance grant that we get from the federal government that goes through the state to our local commission for a local emergency management program is currently capped at the $39,000. We requesting $104,400 from the city and $69,600 from the county, which is basically on a 60-40 split. The remaining balance is how we come up to make sure we have at least 20% of expenses less our hazardous materials response. I do have a line item, a revenue and an expense in our budget, so if we had a county hazardous materials spill, I can collect all the expenses from the responding agencies and then bill the responsible party. So we have that in there just so we don't have to pull our commission together to make a budget amendment on that. And our reserves funds are for our vehicle, computer, and building maintenance. Since I'm a separate entity, I'm not included there with the city capital improvement projects or the county. So I have to maintain that on our own. Just to look at some of the disasters again, we had 8 disasters from 65 to 98, and then from 99 to 2022, actually, we have 9 disasters. Our COVID-19 disaster is still open at this point, as far as we've had some help with the distribution of the PPE, so we've had some help in our EOC that's been reimbursed through that. So we do not have the number on our total number on our what has been from the disaster period for the COVID yet, but that'll show some of the recent the other disasters. So quite a bit of money for public disasters from the reimbursement process from FEMA and the state. Performance measures, the 2 bad ones, obviously we haven't been doing a lot of outreach yet with, but hopefully that'll change now, and we can get back into the schools, get back into doing exercises and doing some of the severe weather talks that we do, as well as having more activity out at the Fire Training Center. And that is what I have for you tonight. I'd be glad to answer any questions.
All right. Well, thank you very much, Tom. We'll open for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right. Do we have any public input here or virtually for the emergency management budget? Seeing no one in the chambers.
There's no virtual input on this item.
Okay.
And no emails received.
All right, thank you. And I'll bring it back to the table for questions or discussion. Yeah, Ms. Russell.
Well, thank you for that information. You mentioned Code Red versus Alert Iowa. Is that just a name change, or are there new features that we should know about?
The Alert Iowa system, the state of Iowa last year opened up its contract for the statewide alerting system, and it was actually, the successful bidder was Rave Mobile Safety. Now, you may know or heard of that before because they're the same ones that Communications Center Manager Murphy works with as far as our Smart 911 program, as well as the panic buttons that are throughout the city. So it's a different vendor is what it is basically, but a lot of these programs talk to each other, so we were real excited when Rave was the successful bidder on that proposal. So our costs will go down since we have the three programs as well, and there's no cost to the locals. And we're able to get, there's more features, it's more up to date. We're allowed to have more logins than we were with the Code Red system, but it is a different vendor is what it is, so.
Thank you.
Any others? I've never seen him so quiet in the first time, Tom. That was pretty good. That was great.
Appreciate that.
No, in all seriousness, though, we're going to be saying this a lot tonight, but thank you for everything that you've done in the last couple of years. You were the center of the storm, so to speak, for everything that was going on, and the work you did with. You were just steadfast the entire time. I mean, I've heard a lot of good things in the community about the cooperation that happened at the emergency management level. So thank you for all that.
I appreciate that. It was really a team effort, and I mean, I'm one person in the office, but we got a great team, and you're going to hear, 3 presentations behind me tonight with a lot of them very important team members that make it easy for me.
Yep, exactly. Well, thank you. We appreciate it.
I appreciate it.
All right.
Thank you.
Well, with that, we will transition then to our next public hearing for emergency communications. So we'll take a minute to make an adjustment here. And you said it's behind the grate? Yeah, we should let Honey Badger trapped in there? The Honey Badger.
Keep coming up in front of my face. The whole campus building is.
All right. Well, next up, we have emergency communications, and we have 6 improvement packages requested, 4 of which are recommended. So, Mark, I'll let you take it away if you're ready to go.
All right, thank you, Mr. Mayor and members of the council. My name is Mark Murphy, the manager of the 911 Center. Our missions, let's see if I get this to work. Our mission statement has not changed this year. We want to ensure the appropriate response is dispatch that meets or exceeds the expectations of the public that's requesting the service. We want to do it efficiently and effectively to get the people to the scene as quick as we can. We've added some new people since the last time we talked. Jenna Jensen, you may recognize the last name, to be the daughter of our chief. She joined our department here in July. And then Haley Walgren and Olivia Sheets, they just joined the department last month. They're all part-time dispatchers at this time. Haley will be going full-time next month. Our leadership has changed a little bit, and it's going to change a little more this year. We still have myself as the manager, Marty Benda, Jessica George Ruthwich. Our leads, Dan Bannon, who's been here for 35 plus years, is retiring at the end of this month. So we're losing a lot of our knowledge base with the retirement of Dan. And Abby Ryan joined our lead dispatcher group just a month ago, or earlier this month, I should say. That was because of the retirement of Julie Rooney. The staff, there's not a lot of changes in the full-time side. We do have 2 open positions. I do list them out with the years of experience. So Amy, who's our senior full-timer, not lead, has got almost 20 years, down to Caitlin, who's been here just under 5. And then you can see our part-time positions. We've added there's 6 of them listed, but 2 of them are PRN. because Mackenzie and Jennifer both they both got other jobs and they wanted to leave. We gave them the option if they wanted to stay, if they have to work a minimum hours a month, and they both jumped on that because they enjoy the work. So we're able to keep them. They're already trained. They can pick up a few hours to try to help with what we need to fill. And so they stayed PRN, and they're helping us out. And then again, we got Haley and Olivia there. And Jenna's just about done with the training program, but she is usable on the schedule. And again, Haley and Olivia, they won't be available to help us out truly for probably another couple months. We do have 2 full-time positions in the open yet, and then we had our clerical position. She left the city and went to work for the county sheriff's department. We're creating an equitable community of choice. We're working with the different partnerships, the state of Iowa, we partnered with them for our phone system. It was more cost efficient for us to do that. We're on the same platform as a lot of the other 911 centers in the state, so we went with that phone system, and we're working with other groups as well for the resiliency and keep the department going the way it needs to go. Fiscal year highlights, smart 911 text messaging. We continue to do that on all wireless hang-up calls. We try calling them back. If they don't answer, we text message them. By doing that, we've been able to get a hold of people that can't talk on the phone because they're involved in a situation that would not allow them to talk. But we are able to, through the software, the Smart 911 software, we're able to communicate with them and get them the help they need, and it's worked out very well. Again, I talked about a little bit before, the phone system replacement. We went to the shared services system with the state. If we would have purchased the system, it would have been just under $500,000 to go with the state system. It was about $125,000 that cost the county. So we completed the radio system P25, the full integration of the system, like Tom talked before. We do have to start replacing some portables and some mobile radios, but the structure of the whole system itself, we moved everybody over. Police and sheriff went over in March, and all the other departments went shortly after that, March of last year. So we've been on it for almost a year, and it's worked very well. I've had no issues. I had one of our Raycom people tell me, hey, we lost a tower, something went down, they lost a piece of electronic. We didn't know it, and nobody on the other end of the radio knew it, because the system is built so that it will self-heal if something were to go down, and it worked very well. He says what's great about it is nobody knows it, and that's great. Like Tom said before, with the new Alert Iowa system, that is integrated, or it's part of the Rave Mobile Safety System, which is what you guys have purchased for the panic button. You've purchased in the years past for Smart 911. It's just another feature. The Smart 911 is all integrated, so if you have a Smart 911 profile, you're already set up for the Alert Iowa. You can go into your profile and click what you want to be alerted for, and wherever you're at. And one thing about with having a safety feature or the safety profile, if you travel, it travels with you. So I've gone to Florida. Thunderstorm watch came out while I was in Florida. My phone beeped that I got an alert because through the Rave system. And we'll continue to work with Tom to integrate that with everything we normally do with it. Some of our future initiatives, we're going to add a full-time position next year. Currently, we have 54 hours of part-time hours that are scheduled a week. With struggling with getting staff, we're trying to fill some of those hours with another full-time position, so we don't have to. We can use the other dispatchers to maybe cover vacation requests or time-off requests. Right now, we're paying overtime to cover some of that stuff, so we're trying to reduce some of that overtime, get the part-timers to actually be able to work more time-off requests than time actually scheduled. We're going to increase our overtime a little bit. We're doing that again this year to keep it more in line with what we normally spend. We're always over budget. We're just trying to get it back to hopefully get it where it needs to be. We're going to hire a quality assurance company. They will log in and listen to percentage of medical calls, fire calls, and police calls. They'll do a profile sheet or a ranking sheet and give feedback to the dispatchers on how they're doing and how they're using the software. Hopefully this will provide better customer service for all the people in the county, get dispatchers all working the same way. It also will help with the police accreditation and fire accreditation because it's something that they need for their accreditation. It's something we will need if we decide to become an accredited agency down the road. We're going to get an additional Pro QA license. This is the software we use for the questioning for police, fire, and medical calls. When we added the sixth position to the sixth phone this year, we have 6 positions. The sixth position never had a phone because it was always just a clerical. But there's been times in there now when, with people in training that all positions are filled. So we added a 6th position, so they're all the same. With adding that, we had to get one more license so that everybody could be on the same software. The property tax cost for the average homeowner for the 911 center is $16.40 based on the 159,503 average. The net property tax for the city side is $1.1 million. The county picks up just under $600,000. Again, it's a 1/3, 2/3 cost sharing. The total budget through the city, and then the county reimburses on the 1/3 of it. This slide I continue to show you. This is the funding source for all our equipment, or most of our equipment. This is the 911 surcharge funds. This is the dollar you get for, or you pay when you pay for your phones. As you can see, the blue line is landline. That took an uptick this last year. And I've heard one of the reasons is the derecho, because wireless went down. And the people who had landlines, they worked. And I had people call in and say, hey, I'm going to get my landline back because wireless was worthless. You know, and with some of the storms that we've had, they've said that to me as well. Could be a reason. That's one of the reasons I've heard statewide. Wireless is, or the wireless is starting to slow down a little bit, going down just a little bit. But overall, we're kind of up and down in our total cost. But this is the funding that was used to buy the equipment, to buy the computers, the radios, everything in the communication center, all this. And we used it to pay for our others, the recorders, phone system, everything. This just shows the number of phone calls we handled last fiscal year, 160,000. We averaged about 35 911 calls a day and about just under 500 total phone calls a day, I think it averages out to be. This is our annual slide to show you our major departments and how their changes. The police department took about a 2,000 increase of calls for service last fiscal year. The sheriff's department over about 1,000. City fire just under 1,000. County fire went up about 500. County law went up about 1,500. And total calls for service, these are actually events generated. Now, the no agency events could be something we start. I'm taking a call at one position of alarm company calling in, say, hey, I got a fire alarm at City Hall, while another dispatcher's getting a call from somebody at City Hall and saying, hey, it's a false alarm, don't send anybody. That event is canceled before it's even dispatched. There's no event generated, but there's still an event started. It's not assigned to an agency, it's still an event. This is a range of answer time for 911. This is one of the things that I want to see improvement on. One of the reasons it's gone down is because of our staffing levels. We're just been short for the last year. I think it's one of the first times we dropped below 90%, which is the national average to get 911s answered. And 90% of the time under 10 seconds, and we dropped just below that this year. And again, it's due to staffing and the COVID. It's just caused some issues. Total calls, we stayed above it. We're at almost 95% where we're answering it within the first 10 seconds. This is emergency and non-emergency calls, and that's the total number of 160,000 calls. This just shows you the last 3 years of the hours of the day that we get calls and that we generate events. As you can see, this last year, it started to pick up more during the day. Starting at 8 o'clock, we saw everything from 8 o'clock till about 11, and then noon all the way, everything's going up till about 5 o'clock. And we're seeing that the call volume is increasing during those hours. A recommended improvement request, the first one is the overtime, again, $6,700. Again, $2236 of that comes back from the county, so the net property cost for that is going to be $4,473. The quality assurance company is $68,586 is one of the company's projected costs. Again, a third of that's reimbursed by the county, so the net cost for the city residents would be $45,904. The additional full-time employee is $78,717. We are eliminating 0.5 full-time equivalents with the part-time hours to put this full-time in, so we're basically using a half an employee from the part-time to make them full-time. And with the county's third, what's left, the net cost for the city residents is $22,769. And the additional software is about $12,000 to purchase the license, and then we have to, a reoccurring cost of $1,800 for the maintenance of that license. Again, a third of it, the total cost will be reimbursed by the county, and the total of the reoccurring cost will be reimbursed by the county as well. Just to kind of refresh the budget impact, if you look at the picture on the left, if you look at the TV screen, you can see a reflection where you can see the cars. There was the plastic panels. My department jumped for joy last Friday when we took them down. They're in the way, banging into them. They can't hear each other, but we took them down last Friday because hopefully we won't need them again. And then the picture on the right just shows you when we were really in the midst of COVID, we split the room up, and that was our back dispatch center. Nobody on either end of the radio or phones, on the other end of the radio or on the phones knew that we were split up. Performance measures, I always talk about our 911 in schools. Well, there's no performance this year. COVID, nobody was allowed in schools. Hoping next year I'll have at least a couple schools. I did have a school reach out to me last week or 2 weeks ago saying, hey, we want you to come before the end of the year. So there's some schools reaching out, so hopefully we'll have more to report on that next year. Our training hours took a dive too because nobody did any training in person. We did do some training remotely. We've also found some software, through some of our software we've been using, they're offering free training now. A lot of the dispatchers are using that training to keep their certifications. They have to be certified every 2 years in emergency police, emergency fire, and emergency medical. They can go into that vendor, take the training, and get all the required topics and all the required education through that. And then we also try to provide additional training. I have 7 dispatchers going down for a day class in Des Moines in a couple weeks. So we're trying to get more training to everybody to increase it now that COVID's over and more training opportunities are coming. Again, and these hours do not include our when we hire somebody new, they have a 40-hour class they have to attend to in Des Moines. They spend hours and hours and hours and months and months and months in training. We don't count those hours on this performance measure. The last thing I want to talk about is we continue to work with the engineering department and the city police department with the camera monitoring. These work well. Dispatchers are always on it. I have a personal note on this. I was involved in a car accident on January 1st. Somebody ran a red light and I hit them, put them in the ditch, and they took off. I called it in before the officer got to the scene. He had told me that they had already found the guy. He was trying to hide, but they found him. And he ran the red light. All the witnesses, the cameras, everything proved it. But yeah, because their dispatchers are so good at using the cameras, they were able to find him before the officer got to me. And at that point, I'll take any questions.
All right, well, thank you very much, Mark. We'll open for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right, do we have any public input for the emergency communications budget? Anybody virtually?
No virtual comments.
And no emails received.
All right, thank you. Bring it back to the table then. Mr. Resnick.
Okay, thank you. The Quality Assurance Program, you mentioned that they'll issue a report card, and so then they're going to tell you what you are doing well and things you need to improve on. Do they give you improvement methods, or they just say get better? Or how do you do that?
Well, that's something we'll work with the company. There's many of them out there. The vendor, the Priority Dispatch has one. They give you basically how to work the software. Follow this. There's a guidelines right through the software. We're working on trying to making it better. And if we have input, we provide it to them. But if dispatchers jump around, it takes longer. And some of the things they may say, okay, actually follow the questions this way, instead of asking this question and then this question and then this one and this one. If you follow right along, they'll give you directions like that. A lot of the guidelines are in there already. They'll just kind of reinforce some of those guidelines.
I see, thank you. And lastly, does this, for quality assurance programs, do those ever factor into performance reviews of employees?
I'm hoping that we haven't been doing performance reviews, that this will be kind of part of it.
See, all right, thank you. Thank you.
Ms. Barber?
Yeah, Mr. Mayor, thank you. Thank you, Mark, for the presentation. And I still recall when I had that wonderful tour and spent some time with you and your team about a year ago, actually.
Yep.
So thank you. You had mentioned the calls for service, and I know that's multidimensional with the other departments that are here. Are there any analytics that could give insight into the nature of those calls? Just to perhaps enhance training and or just enhance our city awareness of what the concerns are within the areas for the residents that make those calls.
Well, I know the police department's done some studies on and they saw like an increase of the mental health calls, medical calls have jumped for the fire department. We haven't really broken them all down. Some of the departments have, like the sheriff's department has and the police department have for theirs, but they use it for their stuff more than I do.
Than you do. Do you think that these will subside now that COVID seems to, or we
think-
have a new normal, as we say here, for post-COVID time?
I don't see it. I don't see anything going. I can see it continue to go. It was going up for every year until COVID hit and things kind of slowed down. But I can see it starting to go back up every year again.
Well, that's interesting. Okay, thank you.
Any others? I have one quick question for you, Mark. We've heard about difficulty in finding new hires. You've got a new full-time position listed on here as a possibility. In your field, are we seeing the same challenges in finding new hires and people that want to work in this field?
Countrywide.
Yeah.
I talked to a lot of my cohorts throughout the county, and they're in the same boat we are. I've been working in radio quite a bit myself, just to fill a seat, and trying to get qualified people that want to work, do this job is very tough.
Yeah. Well, I for one think that it's a great move to be adding another position to this particular department, and also working with the overtime hours that you're talking about there too. I know that it's been once again it's been an incredibly difficult couple of years for a lot of different reasons. As you pointed out, though, the trend has always been the same for you. You've been kind of moving in this direction to do all this work. But do thank your team, please, for us and all the work that you do. We really sincerely appreciate it.
Thank you.
Yeah. All right. Well, thank you. Oh, yeah, Mr. Jones.
I want to thank you for saying that you're prepared for if you decide to go after accreditation. And I look forward to next year when you're standing here telling us when instead of if. So I think that'll be.
Hopefully. Well, we're looking at it.
I know you got to get the chairs filled first,
Right, and that's been the biggest issue for the last year, right?
but you're in for an exciting ride when you
Yep.
pull the trigger on that. And
Yep.
I think you'll like the results.
Mr. Mayor,
Yes,
briefly-
Mr. Resnick. Yeah.
Briefly, I know a former employee who used to work with you and your team. He said it's intense down there. So people who like intensity and really important things to do with their time, that's a great place to work. And it is very important to us. And it keeps them on their toes. And I understand that not everybody can do this work. And that there's a burnout level at some point. And it's interesting, somebody's been there 20 years, that's amazing.
Yeah, there's a couple more. Well, Jessica's been there more than that, but yeah, our senior guy's leaving at the end of the month, and we're losing a lot of knowledge there. But it's a great job, and it's a great career for the right people.
Thank you. Thank you.
Thank you. All right. Well, thank you very much for the presentation.
Thank you.
All right. Next up will be our police department. So we'll take a few minutes here to switch over. All right. Well, that's Chief Jensen that I see standing there, yeah. So we have the police department. We have 4 improvement packages requested. We have 4 recommended. So I will turn it over to you, Chief Jensen.
Thank you, Mr. Mayor and City Council, for allowing me to present to you tonight. I just want to introduce a couple of the team members I have with me. Susan Merriman, who is our budget extraordinaire, is right here with me. And then Captain Joe Meserich, who was in here, disappeared out the door. He's our professional standards captain. This is our mission statement. We've had this for a number of years now. I'll point out here with the next slide, this is our core values. This is some posters we have around our building. The mission statement is part of this, but our 6 core values of integrity, one team, fair, professional, collaboration, and community, and then the tagline, what if it were family, which was created by Chief Mark Dalsing when he took over in 2010. And the essence of that is to treat everybody like their family. There are 2021 retirements. If you look at this, Chief Mark Dalsing, as you know, retired after 32 years. Captain Scott Engelman retired after 28 years. Corporal Steve Eastved, 32 years. Officer Karen Smith, 22 years. And Officer Stan Ryan, 22 years. Collectively, that's over 130 years of experience that we lost this year. This is our organizational chart. As you can see, this is how we're broken down. We have 7 divisions. I'll have a captain in charge of it. I will talk about this in a little bit, but of the captains, with the turnover this year, with retirements and another retirement in August, we'll be replacing 3 of our captains out of this. So we're going to have our senior command staff turnover this year. It's never happened in the 30 years, almost 30 years that I've been here. This is our authorized strength, as you all have authorized to the council. In 2022, we're authorized 113 officers. But as I'll point out here, according to this pie chart, we're down 16 officers. Actually, as of yesterday, we're down 17 officers. 3 officers are in the academy and 3 officers in the field training program, and they're just finishing that up. Of these 3 officers, and that got hired in June 2021, these are the ones that are just finishing the field training program, are Officers Tyler Breitbach, Joseph Conley, and Alexandria Pilarinos. And then in December 2021, we hired Officers Ryan Cole, Evan Hinchin, and Alyssa Klewitter. And they're in the academy and will be graduating the academy at the end of April and then starting our field training program. This is just to show you our recruitment efforts, our hiring, et cetera, and I'll explain this chart. So as you can see, the applications are the top line there, and you can see in the last 11 years on this chart a downward trend in the number of applicants that we've had. Last year we had 68 total applicants. We actually tested twice in 2021, which is the first time we've ever done that. Our collective list, which is that gray line, which allows us to have 40 officers per Iowa code on a civil service list. As you can see, it downward. We had a little bit of spike there in 2020, but in 2021 we went down to essentially lists of 10 and 12 people. As you can see in the ones that actually passed the test, or the middle line there, we had 14 people on that list of 10 that passed the test. The test consists of a written test and a physical agility test. The written test is established by Iowa Code, the Iowa Law Enforcement Academy. We have no control over that. The physical fitness test, the standards are established by the Iowa Law Enforcement Academy. However, this year, and coming up here, we'll be doing this in, this weekend at March 26th, and then March 30th, we're doing pre-tests for the physical fitness test. In the past, we've had people that miss it by 1 sit-up or 1 push-up, miss the run by a number of seconds. So we've added some practice tests to that to try to, also with the ability if the person passes a practice test, it can count as their passing test. So this year we're looking at that. We'll have actually 3 chances for somebody to pass that. Hopefully if there's nerves or something, or a little illness or something like that, they have another opportunity to pass, and hopefully we can get some more candidates with that. This is our Community Resource Officer program, another huge part of our recruitment efforts. As you can see, these are the red shirts. You see them around in the summer. They're riding the bikes. They're in the parks. They're on the bike trails. They're at the swimming pools. They also are part of some of the community events. These are paid interns. Of those, there's 44 people up there. Of those, we've have hired 66% of those over the years. And the last group in 2021 there, we're on par to hire 5 out of the 6 that they're currently in the background testing process. Again, this is and we're going to be adding more this summer to this to begin. It's a very successful program for us. I'll add our school resource officers here because we're going to talk about, as we talk about numbers, this is a collaboration we have with the Dubuque Community School District. We are currently down 2 school resource officers just because of our staffing numbers where we've had to collapse back into the patrol to do response. As you can see here, they're assigned to pretty much every school. We have one officer that is a DARE as a primary responsibility, but they are a school resource officer and receive all the training that all the school resource officers receive. We are currently working with the school district on an equity data project, and it's in conjunction with the Human Rights Department. I'd be remiss if I didn't mention our volunteers. On the left is our auxiliary police. I know the chief in the past has said, they account for about $2,500 of volunteerism a year. This year we haven't used them much. Again, COVID, there's some things that went with that, but we still rely on them heavily when we have instances that are labor intensive, blocking traffic for 8 hours because a tree got knocked down in the road or things like that. They don't even complain. They just come in and do it, which is incredible to have that resource. On the right is our chaplain program. I will point out a couple of things with this. On the far right, Chaplain Charlie Pfizer retired, so he's no longer with our chaplain program. On the far left, and Chaplain Nelson Jenkins, he moved to another church in the western part of Iowa, so he's no longer. And then the second from the left is Steve Hansel, who's actually the founder of our current reiteration, and he recently passed on. So we're down to 2 chaplains right now, Todd Brewer and Charlie Tharp, and they spend a lot of time with our officers. We spend a lot of time, our officer wellness is important to us. They spend a lot of time just being there for the officers. They also help community members. They'll come out on death notifications, help people walk through how to get a hold of a funeral home, how to navigate some of that thing. So they're a very good resource for us. Calls for service. This is a little bit different reporting for us. Again, this is on the fiscal year. As you saw, Mark Murphy talked about that. We had a little bit of rise in FY21 on calls for service. In FY20, obviously we're a little bit down. We kind of expected that with the COVID, and we expected a little bit of rise this year on that. We're still below our average. So we're at 55,000 last year. We're up to 56, or the average is 56. And so like I said, we expected that. And so what I'd like to point out with that is that, even though we see this a little bit of rise in the officers down, we are still responding to all the calls. We're still responding to calls timely, and we're still providing service. So we don't see a reduction in service because of this. Here's our Part 1 crimes. These are the crimes that are reported to the FBI every year. These are the ones that are considered the major crimes. As you can see, murder, sexual assault, robbery, aggravated assault, burglary to motor vehicle, theft of motor vehicle. Those are the ones that are reported. The yellow, the highlighted areas are the highs since calendar year, and these are reported on calendar year, reported since 2014. You can see that in 21, we had tied our high on murders. Of this, we had 5 total. 4 have been solved as of right now, and 1 we're waiting on some evidence from the lab. I will point out of those 5, 4 were committed by acquaintances, and 1 was a vehicular homicide. Only one of these homicides was committed by firearm. As I talked about the theft of motor vehicle, again, we're at a high there. We're looking into the data on that. It really is what we're seeing a lot of the trend is. Somebody loans somebody a car, and they don't return it. And that's we end up with that. We also have a little bit of runaways. We'll steal cars. Here's my plug. Don't leave your keys in your car. Don't leave your car running. This is kind of one of those things that happen. And also there's some drug use that gets involved with that. What I'd really like to point out, though, is our clearance rates. As you can see there, our calendar year 21 clearance rate of crimes against persons, which is the top bunch, is 84.8%. If you look at the national average, and again, the federal government's a little behind us, so they have calendar year 19 is 45% clearance rate. Crimes against property, again, our clearance rate is 89.9%, and the national average in calendar year 19 was 17.2%. Our officers are doing a great job, and the clearance is completed by arrest, it's completed by running the case till it can't be run anymore, or the victim says, you know, I'm done. And that's how we clear cases. So the officers are doing a great job with that. Our shots fired calls. Our shots fired calls, again, from our low of 2018 with 5, we've been seeing a little bit of an increase every year. In 21, we had 28 shots fired calls. Our analysis on that is it literally was 2 factions. Majority of those were 2 factions feuding. Again, majority, we think we've pretty much taken care of that problem, either through interaction, arrest, etc. And again, that's how we looked at that one. I'll point out that we've had this in the past, our comparison years on shots fired and homicides, and this is the cities that are around us. As you can see, some have not released their data yet. And some of it, as you point out, they're not reported. They're not reporting the number of shots fired anymore. They're reporting the number of people hit. So I'm glad to say we're not at that point. Our traffic accidents, we took a huge downward trend. Don't know why. As we look into it, we can't figure this one out. We're really going to be looking to 2022 at the trend to see if this is a trend now and see if there's something there that we can figure out with that. As you can see, the average stayed pretty much the same, but we had a big year. We can surmise, but I don't think the amount of traffic in 21 totally was down all that much. Again, creating an equitable community of choice, and I'll walk through some of our projects here with this. In fiscal year 2022 highlights, the police department COVID response. As I mentioned earlier, our COVID response, we didn't take a hit. We had officers come to work every day. Our calls for service went up a little bit, but they showed up. And they still were here, they still were working, even during the times when we didn't know how COVID affected us and how COVID was gonna, you know, if we got it, what was gonna happen to us. But the officers were still here, and it's a credit to them. They go out and still do their job, even when there is a crisis, a total unknown. And I'd be remiss if I didn't mention them for doing that. Our community diversion and prevention coordinator, the council approved this position last year. We're looking at, and this position it really is jail diversion as what we're looking at, and preventing somebody from going to jail, and how can we do that either before it gets to that point or once they're there, how we can divert and look for a better option for them. We're looking at realigning this position with Leisure Services, some of the things they got going on. Again, this will be a team effort, and we think this is a better fit for that. Some more initiatives are recruitment and hiring, as I pointed out with the previous one. This is high priority for us. We have a very aggressive hiring and recruitment and training plan for this year. Our goal is to fill all vacancies by the end of the year, plus then start anticipating some ahead. And see, our training program, the academy is 17 to 19 weeks. We have additional 20 weeks of training. We're looking at ways we can bring people on sooner, train them more. Our community resource officers, you know, they have a level of training. Can we do more training with them and get them to the point where we can reduce the backside and get people out on the street faster? Additionally, in FY22, we're getting caught up on the mandatory training. So we have certain mandatory trainings we have. The state essentially gave us a freeze on those during these years and extended it out, but now we got to play catch up. So we're doing that. We've got a lot of instructors that need to be recertified, and again, for turnover, some new instructors, things like that. Our mandatory training with brain health and first aid and et cetera. That's all the stuff we're getting caught up on. Our emotional intelligence training, I just want to give you an update on that. And you've heard us talk about this before. We did train all our officers in de-escalation this year. We also trained the fire department in de-escalation. Lieutenant Rick Fomer and myself, we finished our coaching certificate to be certified emotional intelligence coaches. We're using these assessments that we can do in this coaching as part of our new hire in conjunction with our psychological exam to give us a better idea of officers and their ability to cope with certain situations. We also incorporated mindfulness in a partnership with Medical Associates this year, that all new officers go through 4 sessions of that as part of their training. Again, getting them to be able to handle the stress and work through it in the moment, as opposed to trying to decompress later on or maybe not. That's what our goal is with that. And then our succession planning and training. I talked about that, our turnover, our high turnover of our senior command staff this year. None of us are going to be here forever in these jobs, and we want to make sure we're getting the right people in the right spots and getting them to that point so that we have seamless, and then again, the next generations make it better and better and better. And that's our goal. Accreditation. As I talked about before, we were originally accredited in 1993, the longest accredited law enforcement agency in Iowa. We got reaccredited for the 8th time in July of 2020, where we met all 484 standards for that. And then we had a virtual reaccreditation, which happens every year, which they looked at 150 standards this past summer, and we passed that. Brain health. Mark Murphy talked about this. Our brain health calls, as you can see, we went to 743 brain health calls in 2021. The average on all other years was 447. We're seeing a big uptick in this, and this is just the ones that are reported, that we're reporting as brain health. They're not within another call, a criminal call and things like that. So there's actually more than this, and some of them don't get reported to this level in an actual report. So it is one of these areas we've been looking at very hard. We created, or let me start that, all officers are trained in essentially a first aid version of brain health, which is triage, for a lack of a better word. So they can respond, look at it, where does it need to go from here? Can they refer to one of our community partners? Can they refer to one of the 10 officers that we have trained in critical incident team, the advanced training, excuse me, and looking for long-term solutions, and again, trying to get the person with the right provider at the right time. It has been successful in that realm, but it also, again, a very needed realm for us. Again, talked about the emotional intelligence training before. Here's our requested property tax support. The average homeowner's property tax based on the 159,503 is $229.35, and then that property tax support is $15,463,033. Our first improvement package request is for tasers. Council held work sessions for Black Lives Matter in 2020. One of the things that came out of that was looking for less lethal options. Again, another tool that is not a lethal option for the officer. Tasers is one that's out there. It's widely used in law enforcement. The research that was done on this, we also looked at it, the reduction of injuries to both the officers and to the persons we're trying to arrest. And you're generally seeing, and then the studies were done with some bigger cities, you're generally seeing a 65 to 90% reduction to the person we're arresting, and 50 to 60% reduction to the officer. So again, for wellness, it allows us to not maybe go hands-on right away, and hopefully less injuries for everybody involved. The recurring cost of that is $77,960. The second improvement package is for body-worn cameras and car cameras. Again, this is a recurring cost of $131,400. We got our first body cameras in 2016. They're old. They're starting to wear out. The technology on this is just crazy how fast this technology is advancing. Our car cameras, we've had them since the early 90s on some of the car cameras. What we found is we started looking at our body camera replacement, and we found out that the technology has changed. Our current system, which is the recording system, requires us to burn it to disk. That doesn't exist anymore, and it's on the legs of not being supported anymore, because now with cloud or hybrid cloud and all these different options, additionally, just the things the cameras can do, the quality of the cameras, the connectivity, to be able to, if I turn on my body camera in a certain range, we can set that up, other body cameras come on. and we don't currently have that. The car cameras themselves, right now our car cameras and our body cameras, they're the same company, they don't talk. So if I turn on my body camera, the car camera sits idle. If I turn on the car camera, the body camera sits idle. With the new systems, it activates all that. Again, we can set up, geofencing of that if I turn on my car lights, if there's a car within a certain distance, they can turn on. Again, this is just totally, totally changing. But the importance to the public is that we have a transparency and accountability with this. It has been a game changer in law enforcement. And then also, we use them for evidence. I mean, this is video evidence. If it isn't on video, we're almost getting to that point where it didn't happen. So we're seeing this as video evidence. Our third improvement package is negotiating throw phone. Now, throw phone, and I'll explain this real quick. Throw phone, it used to be that when somebody was in crisis. So we have a crisis negotiation team. It used to be called a hostage negotiation team, but they really never negotiated anybody that was a hostage for the release. But it required somebody to go up and throw a phone to the person. Again, because we wanted to have singular communications. It was a landline. We still have this. We still have a version of this because there is, and maybe a need for it at some point in time, but it's 1,000-foot of cord, go up, throw it to them. They pick up a corded phone and talk. The technology has changed. We got cell phones now, so we're allowed to use a cell phone. Again, this allows us to give them a phone in a format that they probably know how to use. I'm a little bit concerned people might not know how to use a cradled phone. We just haven't seen that in a long time. So there's that. The recurring cost for this is $3,000. And the final improvement package we have is hard drive storage. Again, technology changed, technology goes bad. We rely on data. We rely on data that doesn't crash or go away, because this is important data. We need to upgrade our servers at the DLEC. Generally, this needs to be done every 7 years. We're at the 7-year mark of that. And the non-recurring cost for that is $150,000. Our performance measures. So our goals on track, and talk about our police reaccreditation. Again, we do that every year. We hit that goal this year to get that in July. Our kids camp, weren't able to have that last year. We worked this in conjunction with the fire department. In the 2 years that we have had it, we've had about 140 kids come through this, and we'll be doing that again this summer. All things look like we'll be able to hold that, and it has been just a great success for us. Our goals are improving. Obviously, the school resource officer, we need to add those two. We're looking for some direction out of this equity report, and then obviously the funding is there to do that. The goals that need work, and we heard this earlier, the data analysis, evaluation, best practices. We are really trying to put that together so we have one comprehensive report. This is something we're going to be working on that's easy to read, that's understandable, that's consistent, and it's going to cover a lot of different areas. We're able to pull a lot of data, but it comes from a lot of sources, and we don't have it in a single source. So that's a goal that we'll be working on for this year. And that's all I have, and thank you.
All right. Well, thank you very much, Chief Jensen. Let's open for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right, do we have any public input for the police department budget? Anybody virtually?
No emails received.
Oh, I'm sorry. I looked one way and then looked both ways. Sorry. Okay, thank you both very much. Okay, I'll bring it back to the table then, please.
Mr. Mayor.
Yes, Mr. Resnick.
Thank you. Thank you, Chief Jensen. A question about tasers, a couple questions. First of all, so how many incidents this year would have called for the use of tasers?
That's hard to say because we haven't had it, so we don't know if that would reduce some of this injury. We do, and I don't have the number in front of me, the amount of force that we use each year, but that is an incident where we may be able to look at a level of force that reduces, again, the injury that officers get injured at or the suspect got injured at.
So just anecdotally, you must have heard some officers say, I wish we had some tasers for this situation. Is that common?
Yeah, that is a common one. It's another level that's on there. So the sheriff's office has it. It's pretty widespread throughout the United States. Yeah, and that has been one of the officers, because it does allow the ability not to go hands-on, but to be able to stand back and use the dart. So we don't have to have this physical interaction initially. So we believe that's an area that the officers would like to have. And again, another area that they don't have to end up physically fighting with somebody, hopefully.
Thank you. I'm going to just read something from the U.S. Department of Justice quickly and then ask you a question about that. It says, while tasers appear to offer police officers a relatively fast and safe way to assert a high level of control over a situation, shortcomings in both policy and training suggest that a non-trivial number of incidents could be diffused before taser-level force is applied. So my question is about policy and training. Could you tell me what are your plans for policies and training of use of the tasers?
Yeah, absolutely. So our biggest thing with this is de-escalation, right? We've been a lot of focus on that. That's our goal, is to de-escalate first, not to jump to a taser unless the situation calls for it. There's times where things do that. The policy, so we're working on policy with CALEA, our accreditation, the International Association of Chiefs of Police, and then with TASER themselves as doing that. Upon implementing the tasers, or upon getting them, no officer will go out on the street until they're trained on it. And there's roughly 2 days of training that an officer goes through with that, which is almost on level with what we do for firearms on the initial. So our goal is to get a lot of training, make sure our policy is robust, our policy follows what is out there with that. But our goal is not to have this be our go-to kind of thing. It's just another tool for an officer to use that is not their firearm. So another tool that they might have the ability to, because not all things work. Pepper spray doesn't work on everybody. You know, our batons, we really don't use our batons. Batons are, they look nasty when they happen. If there's another way we mitigate things, that's another nice tool to have for the officer. It's a tool that the officer has available to him right now because they carry it on them. It's not in some car, it's not a supervisor bringing it or something like that.
That was one of the other things mentioned in the study, that there's a difference in, what are the policies? And I'm sure, we have an accreditation, but across the nation, they have different policies, and it's just really hard to be consistent and to say, to judge tasers and its use and where it belongs in that, use of force. And so one last question. It's a 5-year program. So do we plan to maybe buy 1/5 of the tasers to begin with? Is that how we're going to do? How are we going to use that money?
No. So the way the program's set up is deferred costs over 5 years. Everybody gets outfitted the first year. It's just deferring the cost over 5 years instead of the big number right at the beginning. So that's one way to do that. At the end of the 5 years, it gets reevaluated, and whether we want to continue with the program or go another route. But it's based on a 5-year. And that's, again, technology. About the time technology it may need to be upgraded, it needs to be changed. So that's why we're looking at that over 5 years.
Well, this is going to be a big change. Good luck with that. Yes, Mr. Mann.
I'm sorry, I didn't mean to interrupt. No. So, but Jeremy, as part of that 5-year payment, isn't there some kind of maintenance contract with the company? So it's not just buy them and pay them off over 5 years?
That's correct. So that they also, as part of that payment, they provide the training, they provide train the trainer training, and they'll provide master level training, which allows certain people, we'll have a couple people, I think it's 2, that will be trained to the level to train our trainers. And then there's a maintenance contract that goes with that, so that we'll make sure that we have a reliable, and from what I hear from the Sheriff's Department, TASER is outstanding with their customer service. If they have an issue, they get things replaced, repaired, and quickly. So that's one of the areas that we want to make sure we have that too. We don't want a one and done and then have all these other costs.
I was surprised that tasers really don't have any competition. There is taser, and that's it. And sometimes what I've read is that sometimes the efficiency rating of tasers aren't what the company says. But I mean, that's really hard to tell when it goes through different fabrics and different things. It's a big change in your department, so I wish you well with that.
Yes, it is.
Thank you. Thank you, Mr. Mayor. Thank you.
Ms. Roussel.
Thank you. I have a question about it was number 11 in the narrative, and it said the insurance premium increased, well, it was over $18,000 due to the instability of social climate across the country, which makes sense. I wondered if the local departments have any way to impact that. Are there things that we can do to show that we're in better control that would impact our rates?
As far as insurance rates for the individual officers?
Well, it just said our insurance premium.
Oh.
It was number, let's see, 11.
Yeah.
Just insurance premiums as general.
Yeah, this is it's citywide, I believe. This is a thing that the city negotiates. We don't negotiate that within the police department itself. It's negotiated through the Human Resources Department on that. So we rely on them to give us the number on where that was going to be.
Okay, thank you.
Actually, I heard, was it you, Mr. Jones? Yeah, I'll go with Mr. Jones first. I'll come back to Ms. Farber.
Just a couple of comments on tasers. I'm well short of expert in use of force, but I'm extremely well-read and I've done a lot of teaching in it and working with it. Quite simply, tasers save lives as much as police officers do. They give an officer an opportunity to not kill somebody when the only other option may be to take the life and go to deadly force. And so I'm really impressed that you're going to that. I'm also really impressed with where you're already at with brain health and with emotional stability and with all the other pieces that are missing in some of the organizations that the Justice Department studied and was critical of. So I think your officers are in a better place already to make the correct decision. An interesting issue that's come up with the one high-profile recent case is, should an energy device feel like a firearm? We had that officer who unfortunately drew a handgun instead of a taser and thought she had a taser in her hand. And I understand why it should look like and feel like a handgun, because officers are already good at pointing, aiming, and shooting a handgun. And I understand the conversation of maybe it should feel completely different so you know for sure what you got in your hand. And that's just going to be a tough training and drilling and repetition thing. And to me, that was what was missing in that department's operations. You don't hear of that particular error happening with great frequency, yet you do hear of energy weapons being deployed with tremendous frequency across the country. And I know there have been people tased in the city of Dubuque, but by our deputies who came in on mutual aid calls and whatever pursuits that ended up here. And talking to Joe and his team, they're very happy with the devices. So I'm glad you're getting there, and I think it's going to be a great life-saving tool for the officers.
And I should point out that training's not one and done. This is ongoing. It has to be incorporated with our other force for that. That is an unfortunate how those things happen, and to try to do our best to make sure that doesn't happen. And again, that's very important to us to make sure we maintain our training, as we do with all our force.
Ms. Farber.
Yeah, Mr. Mayor, thank you. I'm going to your performance measure that talks about total pounds of prescription drugs received through drug take-back events. And your target was 1,400, and in the year of 20, it was 800. Can you give us just a little bit more information about what the environment is and perhaps how that might be related to brain health? And if there's anything we can do to further assist it? I know that there is a drug task force that has been created.
Yeah, our drug take-back is really about prescription drugs, and prescription drugs that end up, I think we've all had that, where they end up in your medicine cabinet. It's like, how long have I had that? And you look at the date, and some of them are pretty significant drugs. And the idea is that, A, you don't have them around, you don't take them accidentally, B, that somebody doesn't take them from you, knowing what you have. And so our goal is to try to get as many of that as back. And that's what the take-back program is about,
Gotcha,
to voluntarily turn that in. And the goal is because we know it exists out there. And so our goal is to try to get as much of that as we can, so it isn't out there. And the other thing is just from a state, the other point people do, they flush them down the toilet. That ain't good for our water. It ain't good for our sanitation. So we don't want that to happen either. So we want to make sure that we get as many as we can, and again, give people the opportunity to do that. And there's no criminal aspect to it. It's just an easy way to dispose of something you may not know how to dispose of.
Okay, thank you very much
Yeah.
for clarifying.
Mr. Spring?
Thank you, Mr. Mayor. Thank you, Jeremy, for everything you guys are doing out in the field. Back to the tasers for just a quick question. Just want to double check. They're only going to sworn officers, so none of our interns, none of our.
That's correct.
Okay. And what about our police officers that are working with our school district? Are they going to have them?
Yes, every sworn officer, they're sworn officers, every sworn officer will have that. Again, we, through our research and what we're looking at is that it does us no good if it isn't with the officer. And if we only do outfit certain officers, it may not be there when we need it.
Will those officers get some type of additional training? Because can they even be technically used on children?
They can, but they won't be, you know, for the most part will not be. Again, our school resource officers are really, really good at de-escalation, and they're really, really good at trying to calm the situation and find other means to do that. Again, it's extreme. It is, and any force is extreme. And if we can avoid using any force, that's our ultimate goal on that.
Thank you.
Thank you. All right, my turn for now, and then we can see if there's any others too. So everybody's gotten around the table here. Thank you very much for the presentation. I have a few questions here, and I want to start with, if you could go back to your slide number 9, the one that shows the number of certified officers with the recruitment efforts, I think is the title for it. One ahead. Keep
This
going.
one? Or, I know.
One more.
That
There you go,
one.
right there. Yep. So I'm really concerned about these numbers. I mean, we you know, you have goals, and I think your goals are laudable, and I really hope that they're attainable. You know, to be able to be at full strength, but then also to you know, look ahead and think about how are we going to continue to recruit officers for the future, not just next year and right now. But with numbers like this, I mean, how do we even do that? And I know that this is a nationwide problem. I mean, we've had a lot of challenges when it comes to law enforcement in the United States. And, you know, so nobody's immune to that. But it clearly impacts recruitment efforts to be able to bring in new officers into the field. How are we really going to go about this if we want to achieve the goals that you talked about?
Really, if you look, when I came into law enforcement, 500 plus people tested. Now we want one person. So we're asking everybody to help us recruit that one person. You know, 10 good quality candidates are a lot better than having 500 people that aren't. So our goal is that we're asking for all help. Our recruitment, we've been out, by circumstance, we're able to have an officer, because of a light duty thing, be out on a recruiting tour essentially for the last 6 weeks, just almost daily, trying to get that one-on-one personal interaction. That's how we find that. You all, anybody, the citizens saying, hey, I know somebody that might want to do this. We're looking at non-traditional as part of this too. I mean, this is traditionally, you know, you go to college, you become for criminal justice, you do this. We're looking beyond that. You know, is this something somebody wants to do? We'll train you how to do it. You know, so we're looking at that. We're looking at just, again, anything that we can get that one additional person. You know, I said we got 8 conditional job offers out now. And we're hoping that we're testing April 23rd, and that test is still open, or the ability to sign up for that test is still open right now. Again, if there's 8 good people that are able to pass the test, that we're giving them opportunity, and we can find that, and again, people recommend, and honestly, that's the best candidates are when somebody recommends and says, yeah, I really vouch for this person, so, and I want them part of our community, and that helps us.
Yeah. You said something really important that I was hoping you were going to say there, that we really want the best people for the job in this situation. We don't want to just, I mean, because, you know, a lot of times when you get to a point where you can hardly find anybody, a lot of other people start to look good, but not everybody's going to be a great police officer, and that's what we really want to look for. So I'm glad to hear you say that. Another question would be, along with this, you know, since this is a nationwide problem, it's a statewide problem, I know we compete with other police departments throughout the state of Iowa, but is there collaboration on you know, for just police in general across the state or across the nation to say, we've got a problem here, how do we improve this recruitment effort so it's not just our problem in Dubuque to solve, it's more of a, you know, we're working together to try to get this done?
Yeah, and there is collaboration, and we talk about it, but and ultimately we're all competing for the same candidates, or not for all the same candidates, but a lot of the same candidates. I mean, locally we have how many agencies that do that. But collaboratively, we're looking at, there's a big problem here. We're not seeing the numbers, and from what we're hearing, that are even going into criminal justice programs in school. We're hearing that's down. And so, again, how do we look to fill these numbers? Is there creative ways that we collaborate with other law enforcement to be able to use your resource to, that's something that we can't do, but we could use your resource to help us with that. And so we've always done that, but now it's more so really looking at that very strategically.
Yeah, no, that's good.
Mr. Mayor?
Yeah,
Could
go
we
ahead,
just
Mike.
stick with that recruitment thing for a minute?
Yeah,
Thank
absolutely.
you. So, it's no surprise to anybody that workforce is a national issue. I think I recently read there's 11 million job openings and only about just over 5 million people looking for work. And then you have certain areas of employment that are even more difficult. And as we can see, police is one, and I think you'll find out in a minute that fire is another. But I recently heard a story from this is an Iowa school district now, where they had an opening for a second grade teacher, full-time opening for a teacher position, that prior to the pandemic, they said they would have gotten hundreds of applications. And in this case, they got 0, not one applicant. So I don't want anybody to leave the room thinking that for some reason the Dubuque Police Department can't recruit people because, maybe it's not a good place to work or something like that. I mean, this is a national crisis, and it is, more acute in some areas of employment, and certainly police and fire are those, but it's not simply a Dubuque problem. But I do think that our police department and Jeremy has come up with some creative ways, and he showed you our CRO program where, what did you say, 65% of our 66% of our CROs we hire. So we came up with creative solutions pre-pandemic, and you can see the numbers were going down pre-pandemic. And we're going to continue to look for creative ways. But I just don't want anybody to leave thinking somehow this is a Dubuque Police Department problem. It's a national problem, including it's our problem.
Right. Yeah, no, you're absolutely right. And I mean, I think it's something that people have been talking about and reading about for quite a while here. And on that same vein, but switching gears just a little bit, I think one of the things we also hear about is this idea of reimagining what policing really looks like and what a police department is. And I think in a lot of ways, it kind of goes with something that Mike was pointing out, the fact that, in 2020, when we had, you mentioned the Black Lives Matter protests happening all across the country, one of the things that I thought was a highlight of what happened in Dubuque is the fact that the police department reached out to groups who were planning the protests, and the protest groups reached back to the police department and worked together. I attended a couple of those protests myself. I mean, I think a number of us did, and was very impressed with the collaborative nature of that. So my question actually on that is, now that you've become chief, I'd like to hear your perspective about how that's going with working with groups in the community to try to, continue to forge those relationships so that, we can continue to move in a direction of having a very collaborative community when it comes to policing.
Sure, absolutely. That's so important to us, and it has been for a long time. We maintain that. We have officers, myself, and a number of officers all the way down through our department that are out in the community, attending meetings, attending groups, part of groups. That is just, you brought up the point. It was so important to us to be on a first-name basis with people prior to crisis. And I truly believe that, and I know our officers believe that that was such a benefit for us, to be able to walk up and say, hi, Jim, or hi, whatever, and same thing back. And so we want to maintain that, because we want to be on the first-name basis with everybody pre-crisis. Besides the fact, we need our partners. To be an effective police department, we have to have our partners. We have to have our community partners. We have to have our community invested in what we do. Otherwise, we won't be effective. And so that's incredibly important. It's incredibly important that we maintain that. We look for new opportunities, non-traditional, reimagining. Why is a police officer there? Because we're a member of the community. We're looking at other venues and getting involved in. So the city has a city leaders program. This is a great opportunity for us to come in and find people and collaborate. And again, just maybe not in that format, but offline. Now we made that. Business cards. I handed out a number of business cards, got some back, had some meetings, had some people come in and just talk about ideas. And so that's the idea that we want to maintain and we want to keep. And I encourage all the officers to do that. Do it. I mean, that's just part of our culture. That's what it needs to be, and it should never go away.
That's great to hear you say that. I'm glad to hear that's the case and that we're going to continue to focus in that direction. I think it's a huge difference maker when it comes to the ability to have a community that's going to be able to work together on things like this. So thank you.
Mr. Mayor? I'm sorry. if
How
I
about
could
Mike first? Yeah, then Mr. Johnson.
just to expound on the answer there. And there's a lot of good reasons to have those relationships that the two of you just discussed, and I'm thrilled that we have them, we had them, and we still have them. But the other side of the coin is, we have an over 90% crime clearance rate. And I hear a lot of people say, well, that's because of the cameras. And sure, they're a great asset. But guess what? It's because of good policing. And the best policing is open lines of communication with your community. And so I feel very comfortable that we have a resident base here in Dubuque that feels comfortable communicating with our police officers to, make sure that people are safe. And so I do think we're working at it, and I think we're succeeding at it. And that doesn't mean we don't need to continue to work at it and work very hard at it.
It takes effort. It takes effort to do that.
Yeah. Mr. Jones.
I just want to say that I think one of your best recruiting tools is to keep telling the story. The fact that you've got a grip on emotional intelligence training, the fact that you've got a grip on brain health management and brain health emergency management sets you apart from many, many, many law enforcement agencies globally, nationally, and in Iowa. The fact that people are coming to you to ask, how did you do it? I think that if I'm a young guy thinking that law enforcement might be a career for me, I would want to work for a police department like yours. And that's part of the message we've got to get out with recruiting, that we're, without being arrogant, we have to tell the story that this is a better place to work than the other options you're looking at, and here's why. And you got all the whys. So congratulations.
Thank you.
All right. Any other comments? Well, thank you for a great presentation and a great discussion. There's a lot to discuss in this, but what I know what I see from my perspective is a police department moving exactly in the right direction. So thank you for the work that you're doing and stepping into the role that you're in. But I hope you can give our thanks to the entire department.
I will. Thank you.
Thank you. All right, we will move on to our last presentation of the evening then, which is the fire department. We'll take a minute here to switch over. We are re-energized. We're ready to go. So we have the fire department here. We have 11 improvement packages requested, all of which are being recommended. So Chief Steinis, I will hand it over to you for one last time here for you.
Good evening. Rick Steinis, Dubuque Fire Chief. Thank you, Mr. Mayor and City Council, for allowing us to present tonight. It's my pleasure to bring you our recommendation from the City Manager for the FY23 fiscal year budget. And it's an exciting budget year for somebody like myself with a little over 36 years in the fire department. I think this is the most exciting budget that I've been a part of personally, and I'd like to get into that. So you can see here that our mission statement has remained the same for a long time: protect, assist, and educate our community and visitors with pride, skill, and compassion. We brought on 7 new firefighters. The number 7 will keep popping up tonight, but these are 7 firefighters that started in the spring of 21, so just about a year ago. They have almost a year on the job. We brought on 7. That was the largest number of people we've hired at any one time through our academy process. So that was a task in itself. What was interesting here is you'll see a couple photos. One photo is them doing the typical things you think of new fire recruits doing some fire training. The top photo is a picture of the drive-through vaccination clinic. They got hired at the height of our preparation and work in vaccination clinics. And because we hired 7 people that were all paramedics, we put them through the training immediately to be able to give vaccines, and within the first week, they were giving shots to the public. And they did this on a weird schedule. Instead of the normal daytime schedule, we said, hey, we need you here on a Thursday night for 4 hours till 9 o'clock at night, and they all stepped up and did that. And that really relieved some of our regular duty people and our overtime to be able to offer those people that opportunity. And I appreciate them stepping up to help us with that effort. You'll hear more about the vaccinations in a bit. This slide shows our current authorized full-time equivalents, 92.16. The .16 is an intern position that's filled on a interim kind of a off and on basis, mostly off right now due to the pandemic. We do have 1 civilian employee, and then you can see here how it's divided up into the other, what we would call suppression and ambulance activities. So ambulance currently has 13 full-time equivalents, suppression has 74, and that's the staffing that you see below in shifts 1, 2, and 3. You'll see that the shifts are not equal in number. 2 of them, when we're at full staffing, have 29, and 1 has 28 personnel. Our requested full-time equivalents in this request for this budget is to go to 99.16. So an increase there. See that we added to the activities again. So we have ambulance and fire suppression again. Most of these, while they're new firefighters, we would end up actually putting people on an ambulance. So the ambulance activity increases, in this case, by 6 people. And the fire suppression activity would increase by 1. But we would actually have more people working ambulances. And that puts all 3 shifts at 31 personnel. And so that'll become important to us as we talk about overtime and required leaves and things like that to provide our minimum staffing. So that's an important number to us to go to 31 on shift. This is a history of our 5-year overtime. You can see that overtime is all over the place sometimes, and it really varies a lot. It's kind of interesting that people think that overtime in 2021 was significant, and it certainly was, but it was about the same in 2017, and there was not a pandemic. What happened in 2017 is we have several people that are off on long-term injury. This could be on-the-job injuries. It could also be personal injuries where people are off for months and months at a time, sometimes up to a year. And so that's what happened in 2017 to create overtime for us. You can see that we're trying to keep that under control in the following years and doing fairly well with that. And then in 2021, we had some overtime that was required. Some of it, again, because of long-term injuries. And we had a couple of long-term injuries where personnel were off for extended periods of time. We also had the pandemic. So the pandemic created COVID leave, which again, because of our minimum staffing, we needed to provide overtime to cover some of those days. And then we also worked things like the vaccination clinics. So for instance, in 2021, we had COVID leave and the need for quarantine members when they were exposed to someone with COVID or they got COVID themselves. So that, again, created some staffing shortages. It also included overtime for the vaccination clinics, and in that case, those costs were reimbursable. So while our overtime hours were very high, some of that was reimbursed. For instance, the work at the vaccination clinic at the Kennedy Mall, where we worked a lot of hours there. One of the things that comes up because of our pilot and some of the things we've been working on through accreditation process, is the stations and ambulance locations. And so this map reflects the 6 fire station locations. You can see that some of them are colored in blue. The larger dots are the blue dots are fire headquarters in 9th and Central, Station 4 at 1697 University, and those are the stations where we have traditionally for a very long time staffed an ambulance. And so those are the 2 ambulances that essentially cover the city, for the most part, split the difference. One really big west half and one very intensely populated east half for the most part. So they're both quite busy. I mentioned this last year and I think the year before. In 19, we started to kind of do a pilot. In 20, we ran our pilot with a 3rd ambulance staffed at Station 2, which is on John F. Kennedy Road. And so you see that in yellow. So the yellow dot is our farthest west station, and that's where we would propose to put a 3rd ambulance if we're allowed the personnel and the staffing to be able to create that full-time ambulance. We ran this pilot in 2020. It showed us that it works, that obviously it provides faster ambulance service and response to the west end of the city, but it also increases the service across the city because we have more ambulances available. We keep the downtown ambulance available more, et cetera. In 21, because of a lot of the issues we had with call volume, we actually ran that pilot and we staffed that 3rd ambulance for a longer period of time than we actually did in the pilot. And we used it because we knew it would work. And so that did create some overtime, but it provided us the ability to respond to all those extra calls that we did in 21. And so we had high call volume, we had high incidence of calls to the west end of the city. We see that more and more as the west end keeps kind of starting to try to catch up with the east half of the city. So we're hoping to be able to do that 3rd ambulance. Some of our equitable community of choice efforts, Department of Paramedics, staff. Oh, sorry, got it on the wrong line. So Department of Paramedics are staffing the vaccination clinics, one of our equity pieces. One of the things I would point out in the pandemic response, I think Chief Jensen mentioned this with the police department, but at the height of the pandemic, the fire department responded to every single call for service, every time. Everybody showed up for work that was able to work, was healthy enough to work, and a lot of people will tell you that they worked way more overtime than they wanted to do that minimum staffing. And the call volume was high. Our call volume at times was probably pretty emotionally and mentally stressful on most people. So we see that obviously with ambulance crews primarily, but every company is busy. So equity-wise, we tried to provide the same amount of service and quality response across the city. We had a few things that came up. One of them, equity-wise, is besides working the vaccinations, we had a grant opportunity through the state fire marshal, and we were awarded $25,000, which we're in the process of developing the program to provide smoke detectors, fire extinguishers, carbon monoxide detectors, and escape ladders if they're needed into target homes in the city. And what we're using is our historical data on which neighborhoods have the highest tendency for fires, where they have the oldest housing stock, those kind of things. So they'll be the target audience to be provided. We think that we can do somewhere in the neighborhood of 200 to 250 homes can be provided those services. So we're going to be reaching out to get that money spent. That's one of our equity pieces. A couple of our highlights for the fiscal year 22. So the past year, I would point out the accreditation that was mentioned by the police department. While they've been accredited for quite a long time, we just got accreditation in October. And I've talked to you a couple of times over the last few years about this. This is one of my passions, is getting this accreditation piece done, and so I'm happy to be able to have accomplished that. It's interesting for us because in the case of fire service, this accreditation is relatively new in the last, say, 15 to 20 years, and it's international accreditation. So you'll see that we're one of 295 fire departments in the world, not the country, the world. So there are fire departments across the world. Our Assistant Chief, Kevin Esser, actually was involved in a site evaluation for a fire department in Japan. It was a military base in Japan, but due to COVID, he couldn't actually go to Japan, so he had to do it virtually. But they do accredit all over the world. Another one of our highlights is the Insurance Services Office, or ISO. It's called Fire Protection Classification. You can see here that we're a Class II fire department. We've been a Class II fire department for about 7 years now. We came down from a Class 3, or up from a Class 3. It's kind of a backwards numbering system. 1 is the best and 10 is no fire department. So Class 2 is among the top 3% of fire departments in the country. Instead of trying to do some fancy video, I wanted to show you these 2 photos. And this is one of the reasons how you get to be a Class 2 fire department. The photo on the left is a fire in Dubuque, and it shows fire blowing out the windows on the 2nd floor. And you'll see a firefighter just opening the nozzle as the fire engine passes in front of the camera. And this is the camera that we had on scene. And so if you look at the grill of the fire engine, you can see there's water about 3 or 4 feet out the nozzle. So it's just in the moments of it opening up. The fire truck passes in front of the camera. The next shot there on the right is the rear end of the fire truck. So about 2 or 3 seconds later, and the fire's no longer in the window. It's smoke. And so that's what we call knockdown. And so we've basically cooled that area of the building and started to suppress that fire just that fast. So it's kind of interesting for us because people ask us about 2-person engine companies and things like that, which are almost unheard of. I have people call me all the time and say, you shouldn't be doing that, you can't put out fires that way. And what we do is we try to use the most modern tactics and the application of science, to the best practice in our industry, and that's a reflection of it right there. And I think the people that are on the engines and the ladders and the ambulances will tell you that we're using these tactics very, very effectively and quite often. As the opportunity presents itself, we use it, and I think to good function. So we are maximizing every person you give us. Another highlight is the Mission Lifeline. And in Mission Lifeline, again, we've mentioned this before. This is a project that works on awarding EMS and hospitals for their work in STEMI heart attacks. So for these particular STEMI heart attacks, you have to go through a process. And so the award has to be given first, earned as a bronze, and then a silver, and then a gold level. And then you have to stay gold for 2 years in a row to get the gold plus. And we've been gold plus for 3 years. So that's a long process of accomplishment in EMS. And so we're pretty proud of that. I mean, the downside of it is you have to have enough STEMI heart attacks to be in the program. But we are obviously out there working every day trying to provide the best EMS service, and this is reflected in this award because it's very rare in the state of Iowa to see Gold Plus, and especially year after year. Another highlight that we'd like to point out was just this recent year when the Greater Dubuque Development Corporation, or GDDC, through their Info Action Survey, asked businesses to rate the public services in the city. And no surprise to me, fire services were rated number 1. EMS, or ambulance services, were rated number 2 in the city among all public services. So we're very pleased to see that. We know it doesn't come easily. We work hard every day to make sure that that happens for the public at all levels in the community. And then finally, the highlight that everybody wants to know about, what happened in the pandemic. I don't know. It's like a blur the last two years, pandemic-wise for me. Tom mentioned, in the EMA presentation, some of the stuff that worked on in the pandemic. And of course, the fire department was part of most of that. But what we did for the community is we staffed, again, that Kennedy Mall pod where they did the shots for vaccinations. And every hour that Kennedy Mall was open for vaccinations, there was a Dubuque Fire Department paramedic there. Every hour, every day, whatever days they worked. Sometimes it was 6 in the morning till 10 at night, and we just rotated people in. We also provided, mostly through administrative staff, transportation and meal delivery to the non-congregate shelter. So there was a non-congregate shelter for people who had no other place to go and needed to be quarantined. And so fire department ambulance did the transportation to and from as it was needed. And fire department staff went and delivered meals every day, and that's 7 days a week to any occupants that were there. So we just kind of, hey, who can take it today? Who can be there at noon and pick up the meals and get them to the people? So we did those. And then, of course, the vaccination clinics that we're best known for. And you see there a couple of photos of the drive-through clinic, firefighters bringing people into the clinic, firefighters giving the shot. So we worked lots of different components of that. One of the reasons some firefighters had to be there initially as they drove in was because there's healthcare reports that had to be done and healthcare questions that a paramedic had to ask and answer, and we had to follow the HIPAA rules and lots of other stuff. We had a refrigerator full of the vaccinations at fire headquarters, and we transported them to wherever we were going to be giving shots, and we had to sign off to the state, what we had for vaccination, meds, and all those kind of things. So our EMS supervisor, Sam Janicki, coordinated a lot of that for us, did a lot of that work. And we're happy to say that 833 people were vaccinated by fire department paramedics. And we did these in several locations. Obviously, the Grand River Center. We also did them at Flora Park. We did them at the Farmers Market, and we did some at Audubon School. And sometimes we only got 3 or 4 people, but we got 3 or 4 people. And because it's 833, in most cases, that meant that they had to come back for a second dose. So that's 2 doses in most cases for those 833 people. Some of our future initiatives for the fire department are in the FY23 capital improvement to update our fire station needs study. It's been going on 15, 16 years now since that's been done, so we think that needs updating. So we're looking forward to getting started with that. We continue to work on our records retention program, and I know the city attorney would appreciate me saying that, but we did purge a lot of records, a lot of old records that we did not longer have to have or didn't need, and then we're in the process now of creating systems through the accreditation process of how we review those records and maintain those records annually so that we don't end up with files full of stuff that nobody remembers. We're also working to enhance our community risk reduction programs, and you can imagine that community engagement has just taken a strong hit in the last 2 years. We were not allowed in the schools. We're still not allowed in the schools right now yet to do some presentations, so we're just getting back to that. Most of the senior living places said, no way, don't come here. So we've really struggled with that. We were not allowed to do tours and things like that, so we're just coming back online with some of that, and we're starting to rethink how we do that, how we get those things done. Even simple things like business inspections. Some businesses, due to COVID, they're like, no, we don't really want you here, and those kind of things. So we tried to work with them. And then the ISO that I talked about, the Class 2, that's been a few years, so we're looking forward to another review of that, and we will probably actually request a review, because I think we have made some changes to simple things like training records, where we can actually show improvement. And so it's to our benefit to go in and request that ISO take a look at us, and I think we'll be doing that within the next year or so, hopefully. The requested property tax support you see there, $11,419,492, and the average homeowner's property tax for the fire department then comes out to $169.38 in this budget. We'll take a look at some response statistics. These are just another look at showing you this year over year. This is a 5-year look at our call volume comparison, and so you'll see that the past decade, we've seen call volume rise an average of 150 calls per year. While the calls are up in most categories, EMS is rising the most. So we do see EMS rising faster than other types of calls. In 2012, the average daily call volume, so 10 years ago, the average daily call volume was about 13 and a half per day for a total of 4,948 responses. For 2021, calls per day averaged 21.6 and totaled 7,894. So nearly 3,000 more calls per year over 10 years ago. And I can tell you that in 1985, when I came on the fire department, we ran daily, with a minimum, 5 engines, 2 ladders, 2 ambulances, a primary and a backup, and a command vehicle. And they did that with 23 people minimum. And today, we still do the same thing with the exact same number of vehicles with 22 people. We lost one through the years. So as the call volume continues to climb, we're doing the exact same amount of people, resources. We're using those to create just much more efficient and more service to the public. So I really think we're at the point where it's time to add. It's to the point where we can't really do much more with less, or even with what we have. We're kind of tapped out. The pie chart is the incident composition. This shows, and again, you may not remember, but it shows that 79% of our calls have been EMS calls in fiscal year 21, so FY 21. And right now, we're probably going to see an uptick in that for 22. So far in 22, about halfway through, a little over halfway through, we're seeing that come up more around 80%. And so again, we see that continuous rise in EMS calls. It's kind of I used to call it a phenomenon that we had all these ambulance calls at one time, and I can't call it that anymore because it happens all the time, and phenomenons don't happen all the time. So it's just a daily occurrence that there are 3 or 4 ambulance calls simultaneous, and we have to try to respond to all those. And so we try to do that. And you see that the fires, the hazmat calls, the miscellaneous kind of other service calls have not really gone down either. They're still there. So we are doing that workload. The look at first unit arrival performance, this is one of the things that we use to measure how we're doing, just a snapshot. And this is the FY 21, so this is how we did in 21. This is at the 90th percentile, so I just point out that this is the total response time from the phone call pickup at the 911 center until fire apparatus is on location. So 9 out of 10 responses will be this fast or better. And that's one of the things that I always try to point out to people, that when it says for a fire, we'll be there with the first unit in 7 minutes and 53 seconds, 9 out of 10 times, and 8 out of those 10 times it'll be faster than 7:53. And that's a pretty good number. And the reason for that is because we work hard to make sure that we're available, that when we're in training, we can still go on calls. When somebody else can't go on a call, somebody else can cover. And when somebody drives to the other end of town, somebody's meeting them going the other way to cover their end of town. And that's a change in how we function as a fire department over years past. And we've worked really hard to do that. So we think we're doing pretty good with it. But again, our call volume is such that we're just running people ragged. One of the things that we're having trouble doing is training. And as you can imagine, a lot of fire training is hands-on, and you can't really just like jump up and leave when you have hoses out and you're connected to hydrants and you're doing things and stuff like that. So it makes it a little bit difficult, and we try to do the best we can. So the long responses, the 10th call in this 9 out of 10, the 10th one is when we're out of place, we're out of position, something is going on where we just can't get that done. But that 90th percentile. And then you see EMS. EMS is an interesting piece because fire, we know that's a small data set, and that goes up and down. It can vary quite a bit. But EMS is thousands of calls. It's thousands of calls. So the statistic is pretty solid there. And when you first look at this chart, you say, well, hey, you're doing pretty good. Your call response time is going down. Remember that in 21, we spent about 3 months running a third ambulance. And that's why that number's down. And that's one of the reasons that we're able to do that. Because of that pilot program, we looked at it and we said, hey, our call volume is going nuts. We got to get to these calls. Let's get a third ambulance in service as many times as we can. So right now, tomorrow morning, our minimum is 22. And if 24 people are available to work, we staff a third ambulance. So it's hit and miss. You might have a heart attack the day we have a third ambulance, and good for you, and you may not. So we want to make sure that that's a full-time, everyday occurrence, getting that third ambulance available. Just go through the activities real quick, what happened in each activity. So the training activity, I should point out that our new Assistant Chief of Training is Josh Napper. He took over from Greg Harris, and Greg moved to operations. He was tasked, he came on in, I believe, March last year, and the first 7 people walked in first week in April for the fire academy. So he was tasked with doing the largest fire academy that we've ever done about 2 weeks into his promotion. Said, happy promotion, here's some work for you. Josh was also instrumental in helping develop the OSHA compliance plan for COVID. So one of the things that is different about the fire department is we're considered healthcare providers for OSHA. So we work under different rules for healthcare providers. A little different than the hospital, but we are EMS ambulance service. So we had to write our own rules based on that, and they're a little bit different. So Josh spent a lot of time going through the, I don't know, dozens of pages that are our COVID compliant OSHA plan. And then we are working on that Blue Card command training. And one of the exciting things for me about that is I'm a Blue Card fan, and I've been following some of this stuff for several decades, and I really believe in the Blue Card kind of philosophy. And so it's an incident command system. It's a little bit tweaked specifically for fire departments. So that's why fire departments are really looking at it. They basically just run you through fire scenarios over and over and over in simulators. And so we have several people now. We have over a dozen people certified in Blue Card. So that's I believe it's a 48-hour pre-course and then 2 days in class doing simulations and learning how to operate and manage and organize your fire ground. So it fits in with the incident command and NIMS training and things like that, but it's just real intense on the fire ground level. And we are now implementing that to the masses, out into the whole fire department. And so we have a critical mass, we feel now, of people who are trained in it, certified in it, and know how it works. Now we need to figure out how to implement it in our department. And again, it goes back to those pictures I showed you about that quick knockdown and how we organize a fire ground and things like that to make things click. And so those are important milestones for us. The fire suppression activity, one of the performance measures we use there is how many structure fires we can contain to the room of origin. Oops, sorry, I'm on the wrong slide. The EMS activity, I should note here, there's a picture up there of Dr. Edwards. So we brought on a new medical director, Dr. Nick Edwards, last year. And he's been very hands-on, which is exciting. He's a ER doctor at Mercy One. And you see here's a picture of him actually at fire headquarters training people. Of course, we were all masked because it was COVID. But we're doing training, he's more hands-on, which is really exciting for us as we try to be the best EMS service we can be. We need the best medical director we can get as well. We did do a new billing provider, which we just transitioned the 1st of January. That's been, again, just something that's taken a lot of time and a lot of struggle for our department. And again, EMS supervisor Sam Janicki working extensively on that. But we think it's going to be good for the department. We're already seeing some changes and some what we think are going to be some benefits on the revenue side. And we think that's also going to be a benefit to the patients. And then, of course, we did a record number of EMS responses. We've never done this many EMS responses in a single year ever. So it was kind of like uncharted waters. And so the picture I chose to show you is that the firefighters who are assigned to the ambulance, the paramedics, are also firefighters. So you can see they have their gear, their equipment's on the ambulance, and they respond to fires. So anytime an ambulance crew is working a fire, they're not available for EMS. And also, if they're working at a fire, they're not available for EMS. If they're at an EMS call, they're not available for fire. So it's a dual role, which I think is a very efficient way to work it, but they can only be in one place at a time. So what we see is when we have 2 ambulances right now, 2 full-time ambulances. So when they're out on EMS calls, sometimes we need a 3rd ambulance. Sometimes we need a fourth ambulance. Sometimes, I don't know, we could probably use 10 of them, but sometimes we just need more ambulances. So the way we do that now is we cross-staff ladder trucks. And there's one of the things people don't realize is that when there's a third ambulance call, a fourth ambulance call, we don't have any ladder trucks to go to a fire. If there's a fire, there's no ladder truck coming because they're on ambulances right now. Same thing when we spend a lot of time at a fire, we know that we're going to get some ambulance calls, and we may be using those firefighters at the scene of a fire, and then we don't have them available for EMS. So again, anything that we can improve in those resources really helps us out. The fire suppression activity, so here's where I got lost. The structure fires contain a room of origin. So this is our metric that we use, and we're doing quite well on it. You can see here that in 21, 78.3 of the structure fires, 78.3%, were contained to the room of origin. And this is important because the spread of flames beyond the room of origin is a point at which the odds of fatalities go up substantially. So if we can keep that fire small, in the room, contained, and that's why you see us doing things like crazy stuff like this at the Canfield, trying to put out a a fire on the fourth floor with a line from the street. And it doesn't put it out, but it puts it down. It kicks it in the knees, and then we go in and beat it up. So essentially that's how it works. But it does work. And I can tell you that there's very few fire departments would have tried that, and very few fire departments would have even been capable of getting that done. But that's just something that, again, we try to do, and that helps us keep it to room of origin. So those are important numbers for us. And the national average, by the way, is 65%, so we're quite a bit higher. The fire prevention activity, a couple things that did happen. Again, Chief Jensen mentioned the fire and police youth camp. He might call it police and fire youth camp. We call it fire and police youth camp. We did hold that this year, and we had to take some time off because of the pandemic, but this year we were able to do it with some social distancing and some masking, and it was outside activities as much as possible. And we worked through it, and we were excited to be able to do that again and get back. And it's kind of funny because I know the kids have a great time, but so do the fire and police officers who are there. They love doing it. We get people signing up to do it all the time. Because of pandemic restrictions, you'll see our numbers are down in business inspections. We would like to have about 3 times more than 312, but again, that's what we could get done in 21. And in spite of all that, we still installed 610 smoke detectors, which means that 138 households are now protected that were not protected before that program. And one of the things that actually slowed us down the most in smoke detectors is we were out. We didn't have any money to buy any. We didn't have, some of the grant programs dried up, and the Red Cross had a program, and due to the pandemic, I think, or whatever supply chain, they kind of cut back. And so it was difficult for us to find enough smoke detectors. So we're just getting back to the point now. That's why that other grant was so important for us to be able to offer those again. So we'll get into our recommended improvement requests. Again, we have several of them. The first one there is 4 firefighter paramedic positions. You can see that for 4 firefighter improvement, this will create the staffing that we need for that third ambulance. So over the course of the last few years, the council's been generous to allow us to increase our staffing, not last year, but the year before by 1, the year before that by 1. So that's a total of 2 people we didn't have a few years ago, and we need 4 more to be able to staff an ambulance. 3 shifts, need 2 people on an ambulance, need 6. So those 4 people would staff that third ambulance that I've probably ran it on for quite a while already. The second improvement is for 3 additional firefighters, paramedics. This would provide some staffing to alleviate the overtime due to the various leave that's required. And so again, we have leave that maybe wasn't even available years ago. Things like there's now 2 personal days, and there's parental leave and some things like that that we did not have in the past traditionally. And those are all great things, but we still need to maintain some of our minimums. So our minimum would go up to 24, and then that 31 people per shift gives us some room to allow those people leave, and then still have a buffer for sick leave, injuries, those kind of things. Being able to send somebody to training if we send somebody to training out of town, say for instance for a week, we can't do it if it's going to cause overtime. And then it's like paying for the training plus paying for the overtime. So a lot of times we deny training based on that, and that's unfortunate. So we'd like to be able to do that. Some of the other improvements that are up there are the health and wellness program. You see that's a recurring cost. The health and wellness program, I think, is going to be essential to being able to take these firefighters that are working at this high level, and just like the police department, there's an emotional stress and a physical stress. We hear all the time about the loss of sleep, the number of hours. As you can imagine, doing 3,000 more calls a year than we did 10 years ago, we get a lot less sleep. So that's one of the things about working 24-hour shifts. You probably should get a little bit of sleep in that time. So those are all stresses that we think this health and wellness program will help us with, because it comes in and helps the employee with a baseline, gives them some idea where they are health-wise, what they can do for improvements, and it does have a lot of metrics tied to it that we can help hopefully find somebody that's maybe going to have a health issue but doesn't know it yet, and maybe find that and save their life sometimes in some cases too, because heart attacks are still number one reason that firefighters die. Next thing we have is a records management upgrade, and this is an upgrade to our existing system. We use ESO records management right now for all of our fire reports and some other stuff. We want to add to it to do some stuff. One of the things that's really driving some of this is on July 1st, the hospitals are no longer going to provide us with some EMS supplies. So that's just a financial decision that they've made. In the past, and I don't know how long this has gone on, a very long time, we've been able to just restock our ambulance supplies out of the hospital. And so we're going to have to buy those ourselves, and then we're also going to have to store them and keep an inventory of them. So this is an upgrade to provide inventory and then also personnel management, which helps us with some of our scheduling that we do in this program, and manages the personnel side of it. And then also the inventory is important because it's not medicine and drugs, but it's everything else that's on the ambulance, and managing those numbers so that we aren't purchasing more than we need, but yet we're not running out critical things at certain times and stuff like that. So we're hoping to do that. And then the medical director's recurring costs, and that again is for Dr. Edwards. It's one of these things, I think you get what you pay for, and so far we think that he's doing an excellent job, and that's certainly a cost that we see as a huge benefit to EMS in the city. Some of the other ones are analytics software. So this is a non-recurring cost and then some recurring costs for maintenance in following years. And this is an analytics software. We're looking at Dark Horse is the company. They specialize in fire department analytics. And so what they help us with is, right now, I can tell you that a lot of the statistics I showed you, Josh Napper puts together, and he knows like what pivot tables are, and I don't even know what they are, so he figures all that stuff out. But it takes him hours every month to be able to create monthly reports and figure out what we do. And we actually went to doing our analytical piece in our monthly staff meeting the second week of the month rather than the first week of the month, because we need to give him more time to put all this stuff together. So we need somebody that can actually help us with the analytics and show us what's going on. And one of the things this is going to do is it's really going to help us with this study that's in the capital improvement project. And in the past, we've spent this kind of money roughly for somebody to come in, do a study one time, snapshot, and say, here you go. Here's your performance level. Here's what this looks like. Here's where you should maybe move a station. And what this analytics software will allow us to do is actually kind of play around with that. So it'll allow us to do it in-house, which I think has value as our people learn our system better and learn our data much better. And it'll allow us to do things like say, well, what if we did put another person on this engine company at this station? And it runs it and it says, here's what your response times would be and how it's going to affect your performance. What if we added another ambulance over here? Or what if we moved the ambulance from this station to that station? What would that look like? And it allows us that kind of data analytics, which I think is very powerful for decision making. Simple things we have in there are portable radio availability. So you heard other people earlier this evening talk about the new radio system, and that's certainly a huge upgrade, and we appreciate that. One of the things that we're lacking in the fire department is just the number of radios available. So standard in the industry now, of course, is for every firefighter on the fire ground to have a radio. And we're able to do that for the most part, except when we do a callback or when we have multiple incidents or something like that. So a lot of our reserve apparatus have one walkie-talkie. And you put 3 or 4 people on that, and y'all have to stay together, or you won't hear what's on the radio. So what we're trying to do is add 7 new radios so that we can provide a little bit more resiliency in that radio cache, primarily for callback and emergency response. If we bring multiple companies in during a disaster or a snowstorm or whatever it is, we'd like to have radios for those people. So that's what is in that improvement package. Some other ones, protective clothing rack covers. This came from the accreditation people. When they came and did the site survey, best practice in the industry, if we were building a new station, we'd have a pressure-controlled room with its own exhaust, and that's where we would store our gear, separate from everything else and where we live. We don't have that. Our gear hangs out next to the truck, in the truck bay. And so it's exposed to exhaust, it's exposed to dust, it's exposed to the light. And so, oddly enough, fire gear doesn't like a lot of UV light. So the UV really denigrates the gear. So we're asking for some money, and this came up, how can we do this, what can we do? Well, we can't build a new room onto every fire station to figure this out, but what we can do is provide some covers so that that stuff doesn't get the dust on it, doesn't get exposed to the fumes as much, and certainly is out of the light. So we think we can provide some longevity to that gear on a fairly cheap basis. We're also asking for some document management platform. The document management platform is in conjunction with the police department, so it's called Power DMS, and what it helps us with accreditation, moving documents around, changing how we process our documents, and simple things like standard operating guidelines or procedures. We can update those and have them once in one place and not have to worry about multiple copies of it somewhere or getting stuck in a file, and having it available to everybody on a common platform. So it allows us with a lot of help with our document management stuff, and I think it would help with the retention piece as well then, because we wouldn't have to worry about how many versions of this are out there. And then finally, fire station dishwashers. One of the things we found during the pandemic was, one person in the house gets sick. You experience this in your own house, right? Everybody gets sick. Firehouse, no different. One person comes to work, and the next day they say, oh yeah, I'm sick, and then guess what? So is the other people that worked with you a couple days ago. And so we think that the dishwashers are a sanitation issue that would help us provide that. So a couple of stations have dishwashers, but we're asking for money to be able to install dishwashers to keep the dishes clean and help that cross-contamination problem. Capital improvement projects, there's a long list of those as well. First one is ambulance replacement and addition. So what we're asking for in the budget is to replace an ambulance, which was already in the FY23, and then move up an ambulance that was an expansion ambulance to add another ambulance to the fleet. So obviously if we have the staffing, if you allow the staffing for a third ambulance, we need to put a third ambulance in service. And with only 4 vehicles, it gets very difficult. If 2 of them go to the garage at the same time, we're in trouble. I mean, we can't keep up with the calls. So we want to have a 5th ambulance in the fleet so that we can, again, have a mechanical reserve available. Some of the other stuff you've seen before, the HVAC replacement fire headquarters, to continue with that project and hopefully keep moving ahead with replacements of the boilers and the air handlers and the controls from 1970. And then outdoor warning siren repair and replace. It's a project I'm working with Tom Berger on and Mark Murphy to be able to upgrade some of the repair parts to sirens that were put in quite a while ago and are starting to show some age. And so we're looking to keep improving those to make sure that we have our outdoor warning sirens up to speed. Fire station exhaust systems, this is getting close to the end of that project. We just installed some last month, actually early this month, at some of the fire stations, and we're looking to complete that project to keep cleaner breathing air from the apparatus exhaust. We also have capital improvement in there for implementing mechanical and electrical design study recommendations. Again, study was done in 2015. We've been using this money to upgrade to LED lighting in the stations. We have a couple stations left, so this hopefully will take care of that project. We usually get a rebate from that, and then obviously we see electrical energy consumption drop drastically when we change to LED lighting in the stations. And it's surprising how bright it is. There's some improvements, or not improvements, but capital improvements in there for Station 5, South Grand View. So that station has some issues with dampness or water in the basement, limestone foundation, rock foundation, and so some of that is waterproofing of the foundation and then landscaping to go along with the groundwater runoff, and replacing the driveway, which is allowing water to run along the building. And then structural beam replacement that's been in there for a while. We're hoping to finally get that done at Station 5. The other ones are fire station expansion and relocation studies. So I mentioned that before, and that's where we want to try to use some of that Dark Horse software analytics platform. And we think that'll really help us create a good study and something that we can use over and over again, rather than just, a study that sits on the shelf and gets dated quite fast. So we think that that's going to be a good improvement. And that'll really tell us a lot about where we need to go in the future. Whether we need a new station, we need to move a station, we need to add a station, we don't know. We really need to get some answers to that so that we can build a better plan, moving forward. And so we think that's important in the project. Station 4, kitchen and floor remodel, is a CIP that's been out there for a while, hasn't been funded. So this is replacing the kitchen. Again, Councilman Jones probably cooked in that same kitchen way back when. The building's built in 1952. The kitchen, we got new countertops in 1996 because I was there when we got them. That was a boon. And we got new flooring, and so this replaced the flooring on the first floor of the whole first floor of the living space, and redoes the kitchen, cabinets, etc. And then finally, Station 6 roof replacement. This is money that's in there to replace the roof. We're remodeling right now, doing that stair improvement, which will be a good improvement to the building. But along with that, it tells us how bad the roof is and how much the roof needs replacing. We kind of knew that was coming in there, so this is money to finish that project all the way out, basically. Finally, I need to end on a sad note. I'd like to just make note of the passing of Fire Captain Jeff Sanderfield just last month, a few weeks ago. Jeff was working at Romberg at Station 6, did a lot of our work in training with confined space and CPR and lots of different things. And so unfortunately he passed away. He was sick for a long time. He was off since December and finally passed away. And we're sad to see him go, so he will be sorely missed. And with that, I take any questions that you have. Thank you.
All right, thank you, Chief Steinis. We'll open up for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right. Nino, I see you waiting.
Yeah. So if you all don't know me, my name is Nino Urba. I live currently on 180 West 15th Street. So I know that, I'm going to try to keep this quick because it's a multi-part question. I know that both the police and fire departments have given their presentations on why they feel they need the budgets that they want for the next fiscal year, but all that being said, I question why they deserve to have those budgets that they're asking for, because between the last budget hearings from the last fiscal year and now, almost $2.5 million have been allocated from the city as a result of resolving lawsuits that have been filed against both the police and the fire departments, and both of which involve sexual harassment and gender discrimination. And I'm questioning that given the lack of accountability that has transpired since the lawsuits have initially been filed, I am pondering what message it sends to the women of Dubuque that if they are going to be treated that way and have no justice being served, if they're going to be feeling wanted or even just safe being active participants within city government. Thank you.
Thank you for your comments, Mr. Urban. We have any other public input?
There's no virtual input.
No virtual, okay.
And Mr. Mayor, I'd just like to state that the City Council did receive written public input from Ed Dissel of 2208 Suzanne Drive on March 3rd regarding the fire department budget, and that public input has been uploaded to the agenda item.
All right, thank you very much. All right, then I'll bring it back to the table for any discussion.
Mr. Mayor?
Ms. Rousseau.
Thank you. Well, thank you very much. It's comforting to know as a homeowner that we have such a great fire department and know that you're there to protect my family if we have an emergency. You talked about our accreditation and the fact that we're a Class 2 public fire protection rating. Does this have an impact on the rates that people pay for their insurance? Does that have a positive impact for us?
The ISO classification can. Typically, when you're into something like a Class 3, a Class 2, it's diminished benefit more likely to residential property owners, and it becomes more important for commercial property owners. So classifications are pretty much, because it goes from 10 down to 1, you can imagine that the more capable the fire department becomes for fighting a fire, the more important it is for larger structures, commercial buildings, that kind of thing. And there's a point at which the insurance company may look at, and each insurance company just uses that information, however they want to use it. So they may look at it and say, Class 3 fire department, yeah, that's good enough for homeowners. We're not going to give them a break if they're a Class 2. But it does affect commercial. And obviously, it's more than the insurance. It can be in the insurance, but Class 2 fire department has shown that they have the resources to do things that a Class 3 can't do.
Well, thank you. It means a lot to me and my family. Thank you.
Well, hopefully we'll be a Class 1 in a few years.
Mr. Sprank.
Thank you, Mr. Mayor. Thank you, Chief, for all of your staff are doing. I've got to see you guys work firsthand in the neighborhood. Just saw you Monday putting out a house fire on Jackson, so thank you. Question is, we're bringing on all the staff, you're thinking of the future. That's all good things, thank you. But is thinking of the future as we also are thinking of electric cars. Are you looking into doing more electric car, like fire suppression training? And as well as we're looking at solar panels, people are wanting to put them on homes. Are we looking into that as well?
So we have done some solar panel training as far as panels on roofs and things like that. That's been available, and stuff like that is out there pretty common. The electric vehicles are the same way. They're becoming more and more prevalent. One of the things that we just looked at was, and you may see this, you always see where some electric vehicle car burned up, and the difference there is that you don't put them out in 5 minutes, you put them out in 5 hours. And sometimes they take 30,000 gallons of water, and so it becomes a big operation. So there are some processes out there. They're not 100% tried and true yet that we know of, but it involves essentially jacking the car up to remove the battery or poke a hole in the battery with a piercing nozzle from the bottom. And So we're looking at that, but yeah, we have done some training. We have some people looking into electric vehicles. The other thing I would point out is we work with our small fleet of vehicles, staff vehicles, et cetera, through the city garage and Public Works. And so they evaluate what we need for vehicles and the cost versus, what we're going to get back on it and things like that. And then finally, there are a few places in the country. The closest one is Madison. You may have seen they have an electric fire engine. And so the technology's there, but the price tag goes along with it. And so again, it's trying to look at that. But I think that you'll see that probably in the next 5 to 10 years as those larger trucks start to become available. And again, the shift. I mean, it's a shift from horses to gas-powered to diesel power, and so now we're getting ready for electric. The benefit of the electrics, all-wheel drive, some of them are all-wheel steer, very quiet, so I think that's important for the neighborhood and the firefighters riding in it, some stuff like that. And they're starting to come out with some that also pump the water by battery power. So obviously that makes you think, what if it's going to take a while, and how do you do that? So there's several different versions out there, but they're starting to pop up, and I think you're going to see that more and more in the next 5 to 10 years, where they're going to become more prevalent.
Thank you.
Ms. Farber?
Yeah, thank you. Just to take off on the electric vehicle, there are hopefully in the near future going to be charging stations as well. And will there be, as Danny just had mentioned, the capability for training if something goes awry with one of those stations, which may impact that car as well? And then will there be ambulances, do you think, also that are EVs?
I think ambulances could probably be converted to electric easier than a fire engine in a lot of cases, because you're really just using the engine, the gas or diesel engine, for transportation to move the vehicle around. We know from past history that electrical issues on an ambulance are always a problem because they use a lot of electrical power, and so there may be some advantage to that. I have not seen many electric ambulances coming out yet. I don't know why, because it seems like that would be a kind of a sensible transition.
Yeah, it's like an electric truck.
Right.
Kind of, yeah.
Yeah, and then I should point out, Assistant Chief Cal Mach is here, and Cal has an electric vehicle, so he's watching the electric vehicle pieces pretty close, and we do need to start looking at the training and the response to things like the charging stations.
Yeah, I appreciate that too, because we have 2 in our family, 2
Sure.
vehicles, so,
Yep.
yeah, thank you. Thank you, Mr. Mayor.
Thank you. Mr. Resnick?
Thank you. I'm sure we all agree here that Dubuque citizens deserve the most capable fire and police departments possible. So thank you for your help in that effort. I want to note here that, as the mayor mentioned, you're 11 for 11 in approvals and $1 million in improvement packages, probably a record in both cases. So it has to be worthwhile services to the citizens to attain that. So again, congratulations on that. I mentioned, and Mr. Sprank mentioned, we have short, mid, and long-term planning involved in this. This has been a long time coming. And, it looks like this budget is not only to reinforce your present operations, but of course, talk about that future transition to a possible new station. And so I'm just wondering, how long has this taken? How many strategic planning sessions have you gone through? And who is your team? Because you come before us, and I mentioned, I know this, that you have some team members back there, but it has to be pretty big.
Well, first off, I should mention the team, because I did fail to introduce who's here tonight. Assistant Chief Cal Mach, who's soon to be interim chief for a while. Assistant Chief Mark Ludescher is here as well. He works operations. And Captain Phil Arnsdorf is here. Phil actually worked on our accreditation team and our standard of cover committee. So the short answer is, the other 91.16 people are the ones who help me all the time. And I get to stand up here and tell you about all their good deeds and their work. But accreditation has been, quite a long time coming. We really started in earnest about 7 years ago. Which If you fast track the thing, you can probably do it in 3 or 4. Most departments, I know departments that have been at it 8 to 10 and aren't done yet. So it just depends. It depends on, again, how much you can keep the train on the rails, because there are a lot of missteps and a lot of confusion when you first learn it. We work with a group within the state that's working on accreditation, so there are some other departments in the state who are accredited. Some have been accredited for a while, and so they're helpful in helping us figure out how to do it. Essentially, our command staff works primarily on most of the accreditation stuff up close. They're what we call category managers. So the different categories in accreditation. So for instance, administration, obviously I had that one, and I work on all those categories, but programs is a huge one. Mark Ludescher heads up that category, and it's got things in it like fire, and then EMS, and then marine firefighting, and aircraft firefighting, and everything else you can think of in EMS. And so there's a lot of stuff in that. But there's stuff in HR, that Cal Mach worked on. So they're just the interesting thing about accreditation is it's everything you can possibly think of that a fire department has or does or touches. And there's a category that it fits in, and somebody needs to look at that. So we've worked a long time on that. As far as strategy, one of the things that we discovered first off was that we did not have a strategic plan. So that was the first hurdle. What should it look like? How do you do it? How do you get it started? Let's go buy a book on strategic planning and figure out how to do it. Ask somebody else how they did it. And so that's kind of where we started. We did a short one initially because we knew we didn't want a 5-year one. We knew it wouldn't be very good. We should probably improve. And so we did that. So we've been able to improve on that process. And just like everything in accreditation, it becomes a continuous process. So it's constantly under review. One of the things that we do now is, like I mentioned, the monthly staff meetings, and we spend considerable time, probably due to me, but that may take 3 or 4 hours. And we look at things like our statistics month to month, and turnout time, and why is this engine company slower than that engine company, and do they need to keep the door open, or do they need to move the cords, or they put their gear somewhere else, or really small things, nitpicky kind of things sometimes, but it does make a difference. And so we look at those things. We've brought, I think, the captains along quite a ways. People used to tell me, captain, lieutenant doesn't make much difference. It's just a different pay grade. And so I've worked during my tenure as chief to make sure that the captain actually means something and has some responsibilities. So they help create the budget. A lot of the capital improvement stuff comes from the captains. They're the ones responsible for their station. They tell me what they need, and we work on it together to bring that to the council. And so there's a lot of people that make it happen. And obviously, the people that don't think they do anything are the people who do the most, and that's the people who meet the customer where they are every day. And that's really the important part for me. This was just brought up to me not too long ago. I have an organizational chart that looks like an upside down triangle. And somebody said, well, this is different. I always see the one that has the chief at the top. And I said, that's not my job. So my job is to support all the people that work above me. And the people that work at the top are the people who directly serve the customer. And so the company officer serves that person, and the assistant chiefs serve those captains, and I serve those assistant chiefs. And all I do is figure out how to stay out of their way and get them what they need. And so that's what you see here tonight, is me trying to get them what they need.
Thank you very much.
You bet.
Thank you, Mr. Mayor.
Thank you. Other comments? So, thank you, Chief. The call volume, the increase in call volume. Do you have a sense of what the reason is for this?
I think I do. The first thing that people want to jump to the conclusion that it's COVID related. Mm-hmm. And we tracked COVID very early on. I think, I'm pretty sure that last year when we spoke on the budget, I mentioned that we actually saw a dip in the responses for EMS, which was unusual. People would think there's a pandemic, there must be a lot of ambulance calls. and our call volume actually went down for a little bit, and then it kind of boomeranged and it came back up. And what we're seeing is just things that I think are related more to people who, first off, are in poor health for various reasons, whether that's related to poverty, whether it's related to age, infirm people, and I think sometimes it's related to people who either don't have the means for a healthcare provider and see a doctor regularly and do maintenance stuff with their health, and I think that's who we see. When we look at our statistics, and if you listen to the scanner at all, you'll hear lots of calls go out for injuries from a fall. And I don't know, maybe there's more gravity than there used to be, but people fall a lot. And usually that's a result of them being sick for some reason, or there's some reason for all these falls. And so we see that, and just recently we saw an uptick in what we would call a sick person call. So they're kind of nondescript. They call 911, I don't feel very good, it's been going on, or it came on suddenly, but they don't have a doctor to call. Where in the past you may have called your physician, and they say, yeah, come on in, or take 2 aspirins or whatever, and people don't have that resource anymore, I don't think. I think people rely on 911. That's what they know, that's what they see. They either don't have health care, they don't have the insurance, they don't have the means, they don't have transportation to go to the doctor, and so call 911. And I think that's where a lot of our EMS volume comes from. So seniors in the community, obviously that's a growing population. I'm one of them. So everybody is getting that baby boomer generation starting to show up in our call volume, I think, a lot of times.
Got it. Well, I know we've had a few comments. One of them is one of the ones that City Clerk Breitfelder actually referred to that, say, do we really need more firefighters at this time? Can we really justify the numbers? And some people think we don't. I couldn't disagree more with that. I think that we need them. I think we've needed them. And I think it's come to a point where it needs to be now. And it's pretty clear. And generally hearing agreement at the table here about this, and I'm glad that you've asked for it. I'm glad that the city manager is recommending it, and that we're going to be moving forward, hopefully, with this particular proposal. So I think it's really important that we do that. I think it's unfortunate. Mr. Erba has walked out of the room, but I think it would be unfair and inappropriate if we didn't address this question just briefly. So I'm going to take a moment to do that. This is our 4th budget hearing? Right? I don't know. It doesn't matter. It's 4th budget hearing. We're about halfway through, right? We've had some high-profile cases this year that have to do with equity within our city government. We've addressed this publicly. As a city, we've addressed this publicly. I know that as mayor, I've addressed this publicly in several interviews. And what I've seen in our budget recommendations, in the budget hearings that we've had all the way through, is this slide on equity every single time. And a discussion of how are we creating an equitable community and how are we creating an equitable city government and workforce. And we are working on it. It is obvious to me. If you're paying attention to what's going on, we're doing the work. There is work to be done. There's always work to be done. And I think that what we're doing is we are openly admitting that and saying it's time to get moving and make some of these changes that need to be made. And I, for one, appreciate that. I appreciate being a part of an organization that looks at itself and answers some hard questions and says, if there's work to be done, we have to get it done. So I appreciate the question. I know Mr. Erba is not the only one that has it, but I do think that we're working on it, and I don't think it means that you don't deserve 7 more firefighters and that the police department doesn't deserve the improvement packages that they need as well. So I wanted to make sure that I openly said something about that because I think it deserves it. So any other discussion before we move along?
Well, if I could, Mr. Mayor, I appreciate your comments, and it would be remiss of me if I didn't thank the city manager for his support in those improvement packages, because this is one of the things that we can look at, but if we can come with good data and good justification, city manager looks at that, and I appreciate his recommendations, because that means a lot to me that he has some confidence in our ability to look at this and plan things out and actually only ask for things that we really think we need.
Yeah, absolutely. Well, thank you. Well, thanks for the presentation, and thank you very much, as we've said all night long, for all the work that you have done. We watched you run ragged these last 2 years, your entire department, and it is something that I'm hoping that we are addressing in at least some substantive way tonight, so thank you.
Thank you.
Yeah, I just wanted to thank the chief for his service. I know he has a
Thank you.
up and coming retirement, and just, you know, with great appreciation here for all that you have done, and best of luck to you in your next phase and your future adventures. Thank you.
Thank you. This would be a hard act to follow.
Yeah.
It's been my pleasure to work for the city since 1985, and I've always enjoyed coming to work, and it's really been rewarding for me to be able to help all the other people in the fire department, you know, be the best they can be.
Mr. Mayor,
Thank you, Ms. Farmer. Yeah, Mr. Jones?
Rick has run himself ragged since I've known him. You used to have to kind of peek in the stairwell first to see if it was safe to go up and down, because after lunch, he'd put on all his turnouts and a breathing apparatus and run up and down the stairs for half an hour. And you didn't want to be in his way, because that could be bad. That's the kind of drive he had to be the best he could be every single day.
Thank you, sir.
Thank you. Thank you for your service all these years. All right, on that note, I believe we have no further business, so we are adjourned.